Most people would probably assume perinatal health to focus on just this period of pregnancy. But I would say that it's really much more comprehensive than that. Ensuring that the community can be well because we are taking care of the mom and the baby and the needs of the family. And if you look at that framework that has been designed by DC Health, it really touches on all the different investments that have been made by the mayor. And we really want to make sure that people understand the resources that are available to them.
When I first became pregnant, my number one concern was finding medical care where I feel like I would have more of a voice in what I wanted.
That is half the battle right there, just raising that level of awareness that we do have services and support for you. I mean, we are a caring community and we are here. We're not going anywhere, and we're serving all of our district residents, not specific cultures, not specific communities. We're here for everyone. Quality care does exist in the District of Columbia. I am proof of it. I provide it every day at Mary Center.
Here at Community of Hope, we're working with women and families who need help, from all the little basic, simple things as filling out paperwork to get WIC support, from helping to make sure her insurance is, still active. We need to have that, support in-house to help women. It's about having all these pieces and having a staff that mirrors them is really, really important.
With me, it was difficult for me to navigate the healthcare system and articulate myself in such a way that I was getting my questions answered. So the wonderful thing about the Nest was that I was now giving the tools to be able to track and understand what types of things were going to be expected to be happening to my body. As a new mother, those are things that I think a lot of other mothers take for granted. Even the OBGYNs kind of have the expectation that you kind of know what to expect, and you don't. You don't really know what to expect when you're expecting.
The Stork's Nest helps women to know ahead of time what they are going to experience. We show the mom how to take care of the baby. We connect with other agencies and organizations that can support her after the baby is born.
We're not only talking about our local investments and our local innovation and the things that we're thinking about, but we're able to also couple that with other best practices that are happening nationally in order to move the needle forward.
I am super thrilled that the mayor has started having these summits. I think it's a great opportunity for us to learn about each other and learn what everybody's offering, and try to really work on creating best practices. I do feel more optimistic that we're going to finally start to dismantle these systems and make change.
The mayor is extremely committed to it, and I think her as a mom with Miranda right in tow, I think it's really exciting.
It's a cliche, but it's the truth. Children really are the future. So it really is an investment in our society, and really it helps get our country and community strengthened.
For me, this is ministry, to help other people to realize that it takes a whole village to raise a child, and that we all play a part in helping to keep it healthy, and that we can make a difference.
What makes me really feel good about the work that I'm doing is that I'm responding to a calling. It's hard to do this work, but the commitment that is needed to continue to do it is real.
And now we welcome the Honorable Muriel Bowser, Mayor of the District of Columbia.
Good afternoon, everybody. I'm Muriel Bowser, Mayor of Washington, D.C. Welcome to our third annual National Maternal and Infant Health Summit. We aren't together in person this year, but I'm glad that we're still able to convene virtually to continue the conversations we started more than 3 years ago. This year's summit is a call to action. We know we all have a role to play in turning this crisis around. The ongoing COVID-19 pandemic reminds us of the inequities that have continued to persist just below the surface. It is a reminder that the health of women and families does not begin and end with pregnancy. As a Black woman and a mother, these issues hit close to home for me. The issues of maternal health and its outcomes are rooted in equity. And by now, we all know that people of color here in Washington, D.C. and across the nation disproportionately suffer high rates of maternal mortality. By bringing together health professionals, activists, parents, and public officials, we can do better. We can answer tough questions with strong policies. We can raise awareness and create real change. Together, we can save lives and build healthy families. After our first Maternal and Infant Health Summit, we launched Thrive by 5 DC under the leadership of Dr. Faith Gibson Hubbard. I want to thank Faith and her team for working alongside Director Lamont Akins in the Mayor's Office of Community Affairs to plan and execute this year's summit. Our Thrive by 5 Coordinating Council has worked to identify gaps in our systems and communities and craft solutions to address and ultimately close those gaps. We launched the Maternal and Infant Health Initiative to engage more deeply in the community regarding maternal and infant health, and we hope we can provide a model for other cities to follow. I want to thank you again for joining us. I hope you enjoy the panels, and I look forward to hearing your experiences and perspectives.
And now we welcome Dr. LaQuandra Nesbitt, Director of DC Health.
Hello, I am Dr. LaQuandra Nesbitt, the Director of the District of Columbia Department of Health, and it is my pleasure to welcome you to the 3rd Annual National Maternal and Infant Health Summit. Just by your attendance throughout this conference, you're saying that you understand the importance of this issue, and you want to know more about how we can collectively address the impact of the COVID-19 pandemic on district residents and systems, and particularly our pregnant women, moms, fathers, and babies. In the district, we have worked to fully realize a framework that is based on the goal of ensuring that every community understands its health risk and its role in improving the health and well-being of mothers and babies before, during, and after childbirth. With this framework, we are able to focus on several priorities, which begins with women and girls having control over their reproductive health, making sure that all healthcare providers utilize the tools and resources necessary to ensure that women and babies have the best chances for success, making sure that every parent has the tools and resources they need to provide for their families and create healthy environments for which parent and infant can thrive. Over the next few days, you'll not only hear from district residents, but also elected officials, health and education officials, and community-based partners who will share their expertise as we look to continue to improve perinatal health and address racial disparities in birth outcomes. During today's panels, you'll hear more about how this pandemic has affected pregnant women, moms, and babies, and how we can move forward during this unprecedented time. You'll also hear how trauma affects all of us, no matter where we are in life, as well as how youth are using their voices to make necessary changes in perinatal health as time goes on. An exciting and enriching agenda has been planned, so I want to welcome you once more, and I hope you enjoy this year's National Maternal and Infant Health Summit. Thank you.
And now we welcome Dr. Faith Gibson Hubbard, Executive Director of Thrive by 5.
Hello and welcome to Mayor Bowser's 3rd National Maternal and Infant Health Summit. My name is Dr. Faith Gibson Hubbard, and it is truly a privilege to serve as the first Executive Director of Mayor Bowser's Thrive by 5 DC. So here we are, again, another year, and this year we are virtual. But we know that today and this week is more than just a feel-good annual pep rally. It is a time for us to renew our commitments and to accept the call to action where we can work collaboratively towards healing our communities and improving the well-being of pregnant persons, families, and babies. Since we convened last year, Thrive by 5 DC and the Thrive by 5 Coordinating Council has worked in partnership with many of you to focus intently on all things maternal health through age 5 in the district and beyond. And the current pandemic has only deepened our focus, expanded our partnerships, and sparked new relationships and strengthened our resolve to create the positive outcomes we want to see right alongside you. This year's summit is very special. Thanks to Mayor Bowser's innovative leadership, we have broken the mold and we have built a system that allows us to take this conversation beyond the walls of the Convention Center, past the boundaries of the District of Columbia, and right into the homes, hearts, and lives of so many who care about maternal and infant health the way that we do. As a Black woman and a mother of two, this summit and all that we talk about here this week is personal to me. You see, when I look at my children, I'm reminded of the many trials I experienced just to see their little faces. There were times that I didn't feel listened to. There were times when I felt that what I was feeling didn't matter and that I didn't matter. But there were people who fought for me, and because of them, I survived. But maternal and infant health has to be about more than just surviving and resilience. The outcomes and lived experiences that we read about, share in hushed whispers, and at times scream out loud have to mean more to us, and we need to show the evidence of that in our actions and in our practice. This year's summit and our theme, Rethinking Our Perspectives, Retooling Our Actions, can again spark more than just polite conversation, but actions that we will be able to see in years to come. It is my hope that you will enjoy the conversations today and join us for the rest of the week. To find out more about what's to come, please visit dcmaternalhealth.com. And before I close, I want to thank Mayor Bowser again for her leadership and for the opportunity to be a part of something so special. I want to specifically thank my colleague and co-conspirator in this planning process, Lamont Akins, who is the director of the Mayor's Office of Community Affairs, for his continued partnership, and a huge thank you to my Thrive by 5 colleague, Tiffany Wilson, for putting her all into every single detail. And finally, I want to thank the entire Summit Planning Committee and all of the agencies who have offered their support in order to make today possible. So again, welcome, and I hope to see you all week. Good afternoon, and thank you for joining us. I would like to introduce our first panel, What We've Learned from COVID-19, the Pandemic's Impact on Perinatal Health, and Our Next Steps. Panelists include the Honorable Muriel Bowser, Mayor of Washington, D.C., Moderator Erin Haynes, Editor-at-Large for the 19th, U.S. Representative Robin Kelly, Illinois' 2nd Congressional District, and Dr. Alethea Maybank, Chief Health Equity Officer of the American Medical Association. Unfortunately, due to unforeseen circumstances, Dr. Anthony Fauci is not able to join us today. But we know this will be a great discussion. We hope that you enjoy, and that after this panel, you will enjoy the videos and take a quick break and join us for the next panel. So now I hand it over to our moderator, Erin Haynes.
Erin Haynes, Editor-at-Large for the 19th, which is a nonprofit, nonpartisan newsroom focused on the intersection of gender, politics, and policy. I want to welcome everybody that's tuning in today. This year's summit is the 3rd annual, as was mentioned, but it is a little different. Mayor Bowser, obviously, we'd love to be joining you there at the Convention Center, but we are unfortunately virtual due to the pandemic, which is affecting so many aspects of American life and exposing inequities across our society, including as it pertains to maternal and infant health. This is also an issue that we at the 19th have been particularly focused on, and I will just invite everybody watching today to please read our coverage on this issue, which you can do by visiting 19thnews.org. Now, before we get started today, just a little bit of housekeeping. You can share today's conversation on social media by using the hashtag #DCMaternalHealth and by tagging @MomHealthDC and @Mayor Muriel Bowser. Now, with that, I want to dig into this important and timely conversation. And Mayor Bowser, I'm going to start with you because I know how important this issue is to you as both a leader and a Black woman in America. The issue of disparities in maternal health is finally getting more attention, which is a good thing, but it's important for people to have the facts, especially in a pandemic. So I just want to start by asking you, what is the state of maternal and infant health in the District of Columbia, and what are the challenges that remain as you see them?
Well, thank you for that question, and thank you for agreeing to host us. This is going to be our 3rd Infant and Maternal and Infant Health Summit hosted in the district. We reached out over the course of these summits nationally to talk to national thinkers like yourself, doctors, moms, practitioners, lawmakers to be a part of this discussion. And this year we're doing it a little differently, but we'll still have over 6,000 people who have signed up to join us over the course of the next several days. I am in our convention center in Washington, D.C., and we're broadcasting to households all over our country to talk about the state of infant and maternal health in our country. And what we know is that the United States can and must do better. We do not compare favorably to our fellow world citizens and developed nations when it comes to how mom and babies do. And in our own city, while our numbers, our real numbers are actually quite small, we still have too many women who die in childbirth or soon thereafter per 100,000 live births. So that is why we have been laser focused on how to change the trajectory for women's health and for mom's health and for the lives of their infants. And we know that it's more than a medical issue. It's an issue that has to do with how women fare in our city. It has to do with the institutions that we know have troubled paths. And it has to do with how we value making sure all of the things that make for healthy women and families are in place, including good nutrition, great housing, and access to high quality and culturally competent health care.
Yeah, such a good point you're making about the intersection of all of those things. It's not just a health issue, but it is tied to other societal issues that are disproportionately affecting women and of color, especially. And so with that, I want to turn to you, Dr. Maybank, and I want to ask you a little bit about the national scope of some of what Mayor Bowser talked about. What does the maternal health crisis still mean for women of color and particularly Black women, frankly, especially in this pandemic?
Absolutely. So first, thank you for this invitation on this panel. Thank you, Mayor Bowser, for the work that you've done. And also thank you, Congresswoman Kelly, as well, for the work and leadership that you have done over the years. And just really an honor to be here. So, as was already mentioned, the United States is really, we're doing kind of one of the worst in the world in terms of industrialized nations. We have about 700 moms and people who are doing birth or having birth pass away every single year. For Black and brown moms, and Black moms specifically, our death rates from maternal mortality are about anywhere from the range from 3 to 4 times higher compared to white moms. And if we go to other parts of the country, it can vary. I'm in New York City right now, and our rates have been anywhere from 8 times higher to 12 times higher. So it's a tremendous disparity that exists in our country. What is really, I think, key and critical now, and we're now in this time where people are calling and naming racism. I feel many folks are now understanding that racism is really the root cause of why these inequities exist, which means we get to shape and frame kind of the way in which we've created responsibility or said who's responsible for this problem, right? And shifted away from Black people fully and Black birthing people, and look more so at our systems and structures that were already mentioned as it relates to where people can live and the types of jobs they can have and their opportunities to build wealth or not be able to build wealth, and whatever kind of healthcare and access that they may have as well. At the institutional level, though, it's always also really important to point out, and I'm at the American Medical Association. We have a membership of about 210,000 physicians, which is about 1/5 of the physician population. And we work a lot with healthcare providers, and we're very clear the evidence shows that there is much bias that exists on the part of healthcare providers. It affects the quality of care that can be provided for Black birthing people. And it also affects, their perceptions of how they treat people. So we know that there are providers who have biases as it relates to pain and how they evaluate pain, as an example. We have studies that show that med students have these perceptions still that Black people have thicker skin or that they have nerve endings that are different. that are different. And all of this influences how we are treated as Black people within the healthcare system. And what we ultimately know and really hear, and what the evidence shows and what the stories tell us, is we don't even need numbers for this, is that Black women are not being listened to. We have all the stories that are coming out on the news media about this, with popular and celebrities that are experiencing this as well. But this happens, on a daily basis. And we've learned now, there's even more recent evidence that shows that white doctors who are caring for Black babies, those Black babies are actually 3 times more likely to die in the hospital than the white newborns. That's recent data. And that's starking, and that we need to do something about it. But all of this, really comes together and creates stress for women. And we know that the evidence shows that these stressors impact our immune systems, they impact, our risk, and actually increase our risk of having babies earlier and at lower weights. And so now COVID's here. And what COVID really does, and I really wanted to highlight all of that first, because what COVID does is just exacerbate all of that. It is the same explanations, right? The similar structural issues, the similar provider issues as it relates to injustices. And there's just so much pressure on families, especially, for Black women who are usually holding many of their families together. We're in this unemployment crisis, and there are so many social inequities that are existing. And even, situations in which there are delays in testing, many folks don't realize this, impact essential workers' ability to go back to jobs. And many Black women are in what we call the frontline essential worker jobs. And it challenges their ability to find childcare and really put food on the table as well.
Yeah, that's such a good point. And yes, I mean, if someone like Serena Williams has to worry about, possibly dying in childbirth, what does that say for women, who are without her kind of resources or notoriety, right? Congresswoman Kelly, I want to come to you because you are among the women, particularly in Congress at the federal level, who have tried to raise the alarm about this issue long before kind of the current moment that we find ourselves in. But it does feel like the public is at least more aware and responding to the maternal health crisis in this country. I wonder if you agree with that assessment, if that's something that you have kind of seen in your time in Congress as you continue to try to raise this issue. Is this something that you are seeing your constituents, other Americans really more concerned about it? And how do you think we got there in terms of the level of awareness and concern around this issue finally?
First of all, I want to say greetings to everyone. Greetings, Mayor. It's good to be with you, Doc, and thanks for your kind words. I really appreciate it. And I bring you greetings from Karen Bass, the chair of the Congressional Black Caucus also. I do think the public is a lot more aware because of celebrities that it's happened to. People can't believe, because of what you said, their resources, that they actually go through the same thing also. And I give Judge Hatchett and her son a lot of credit because he's gone all over the country. And actually, we did something with him about 3 years ago in Washington, D.C. I didn't realize myself what an issue that it really is, that it was safer for me to actually have my daughter than it is for my daughter who hasn't had a baby yet to have a baby. And so I just think because the light is really being shown on it, that's why more and more people know about it. And some states are trying to step up to the plate. In Illinois, Black mothers are dying at 6 to 1 times the rate of white moms, and the state legislature they're shining light on it and trying to do something about it. I think it goes back to, we say the social determinants of health. I say the social determinants of life, actually, lack of access, housing, the education where you work, and on and on and on. And just the systemic racism that has continued. The other thing is it's been proven over and over that you do better when it's someone that looks like you treating you, or at least understands the realities of your situation. So we have to diversify the healthcare pipeline, not just doctors, but in a lot of different fields in healthcare.
Yeah. Yeah, and just to your point, those social determinants of life are the things that have been, the inequalities of those have been laid bare in this pandemic. And I think That is why this issue in this moment has become critically important. I want to stick with you for a second, Congresswoman Kelly, to ask you, and then I want to also go to Mayor Bowser after this to talk, if I can hear from both of you about how citizens and voters really, who are now concerned about this issue, can get involved at both the local and federal level. What advice would you have for folks who are wanting to know, I care about this issue, what can I do?
Well, I will tell you, I had, or still have it, a bill called the Mamas Act, and not to be partisan, because I work in a very, very bipartisan way, but I couldn't get one of my colleagues on the other side of the aisle to sign on to the bill, even though they represented states that were 1, 2, and 3 in maternal mortality issues. So I'm going to say, call, write, email your congressperson, your house person, or your senator. Of course, that's one great way to do it. Let them know that you're listening, you're looking. Also, the other thing is talk to your doctors about it. Also, let them know that you're, listening and looking, and you're advocating. But I think making our voices heard is the best thing to do. Also, the other thing I'm going to say, and I know the mayor will like this, to fill out the census, because money that goes to programs in your area based on how many people we think live there. And COVID has exacerbated the need for more resources around health. And so if people want more resources in their area, please fill out the census. That's something else you can do beside vote.
And I would add to that, and thank you, Congresswoman. The census is very important, and we're pushing for everybody. A lot of cities, including ours, are experiencing lower levels of response, COVID, distraction, you name it. And so we want everybody to answer the phone, go online, mail in the form so that we can be counted. And more than that, I would say, I want everybody in America to have access to high quality health care. And we're still fighting to keep the protections that the Affordable Care Act offers in so many jurisdictions. We feel very privileged in our city. We've invested heavily so that over 90% of our people have health insurance. And we want to make sure that they're using it, that they're going for well women checkups, prenatal visits, after birth visits, that they're getting vaccinations, and that they are going and finding the care and the provider that works for them. And what we have found is that people are more likely to go to a doctor, a provider in their own communities, a person that they trust, that are part of a trusted network. That's why it's been so important for us to invest in these federally qualified health centers throughout Washington, D.C. It's also important that that's one part of our integrated network, but that we have specialty maternal care as well for so many of our women who are in more complicated pregnancies. We need those specialists and hospital care close to them. That's why this year, even amid the pandemic, we're very proud to have crafted an agreement that's going to get 2 new hospitals in Washington, D.C. over the next several years. One in Ward 8 that's going to serve women who have been underserved by this specialty care. And we're also investing in an agreement with Howard University that's going to allow them to rebuild their hospital, secure the future of their medical school, and train more African American doctors. So all of those things we know will be a great benefit for our voters. And when we go around Washington, D.C., people care about healthcare. They care about geographic distribution of those resources. And one thing voters can do is hire more women because we know when women and our male allies know the importance of this issue, it stays on the agenda.
Yeah, tying this to voting in the census, I appreciate you doing that because not everybody may make that connection necessarily. Dr. Maybeck, I want to come back to you because we know that COVID has put immense pressure on our nation's healthcare system, as the mayor was just saying. I want to talk to you about what you've seen in terms of how COVID is exposing gaps in our healthcare service delivery.
Yes, thanks. And I'm going to come back to voting as well, because I think it's really important from the healthcare provider, but I'll first talk about the healthcare system. You know, what I think COVID really has shown is that we have a long way to go to center equity. So as I hear the mayor, you know, talking about opening hospitals, I think that's great. And I think as those hospitals open, and this is anywhere in healthcare institutions open and work to strengthen their systems, they have to be very intentional about centering equity. Equity doesn't happen, you know, it doesn't just happen. We all know that. And we have to fight for that and be very intentional about that. Because what will happen is that even with good intention, if the systems are not set up to be equitable, if the processes, if the quality within that system or the structure of the healthcare system, it is going to revert back to the cultural norm, the dominant norm that ends up not valuing Black and brown bodies and causing the violence and harm that we are really trying to work to prevent. You know, as was already mentioned, significant impact in terms of the lack of insurance and inadequate coverage at this time in many different ways in different parts of the country. There have been closures of hospitals. And oftentimes, you know, I think there's been more focus on, as Congresswoman Kelly called, the social determinants of life, or the social, I don't know if I'm saying that right, the social determinants of life, yes. Is that our healthcare system really fully can't even adequately address social needs in the ways that we really need it to do. Oftentimes, and historically, it's really been about, you know, the healthcare service itself, the doctor's office, the hospital, but not enough connection and context to helping to support all these other areas of life that we know need support. And it really, if the healthcare system doesn't evolve to do that and do that in more meaningful ways, it's, you know, who else is going to do it? And I think something that I've really noticed, you know, I was in public health and governmental public health for a long time as deputy commissioner in the New York City Department of Health, and now really coming into this public health or healthcare space. And one of the big, I think, challenges that's in our country is kind of this divide between our public health system and our healthcare system. And this is really important, I feel, on a policy level, but on a practical level. Our public health system has been completely exposed in a way it has, and it's more visible than it has ever been. And folks are understanding this larger context of what creates health and the importance of public health systems, but they're so underfunded. They're very well organized. You know, we just relaunched last week the 10 essential public health services that were started 25 years ago that tells us all the things in the roadmap that we need to put forward for public health, but it's so undervalued and so underfunded. And we in public health and healthcare need to come better together. And I think that is an opportunity that we need to capitalize on. I think opportunities also as it relates to, you know, training, even though I'm a believer that training is not sufficient enough, but it is important in terms of in anti-racism training, structural competence training. Some folks refer to cultural competence training, but all these are very important in order to support and build our systems and our healthcare system so they're operating in much better ways.
Yeah. You know, I want to. You talked a little bit about what needs to happen internally. I want to ask you too about externally and how challenging the role of kind of getting timely and accurate healthcare information when faced with a global pandemic, particularly for pregnant people, right?
Yes.
What are the challenges of that? And for people who don't understand, I mean, why it matters?
Well, I think it matters if we think about it for, you know, ourselves. You know, important and accurate, timely information helps us have some power over responding for our own health, power for ourselves, power for our families, power for our loved ones. And it is a primary function, again, of public health. But if we don't have it, if we don't have it in a timely manner, it's really hard to respond. It's really hard to have a sense of security during a time that it's really hard to have a sense of security. And so the more information that we have, the faster that we have it, the more honest and transparent that we have it. Because sometimes information is not known. COVID is a great example of that. There's a lot we still don't know and understand about COVID, but communicate that, you know, and communicate those parts in an honest and transparent way is very helpful. Having communication that's in languages different languages is very important. We are not homogeneous as Black folks. And so we need to have different types of ways of hearing information. I think also, what's happening is this realization, and I know the mayor as well as Congresswoman really understand the importance and value of trusted messengers to deliver those messages, and credible messengers within our communities, as we do this forward. And not just to deliver the message, but also to give us feedback as at institutions like myself, being at the American Medical Association, or when I was at the health department, that we get feedback to make sure that the messages that we're putting out even make sense, or they translate. And that they're nuanced, enough. COVID, when our initial kind of stay-at-home message came out, it wasn't nuanced enough for folks, especially folks who are essential workers. What do they do, when they have to care for people and they have to go to work? So we have to work on these communication pathways. And then in terms of credible, message and kind of trusted information, that's obviously has been a challenge. I'm very kind of vocal about that. And, we at the AMA, we've worked really hard for our providers, definitely, to make sure that we are rapidly putting out information for the providers that are trusted. We've built lots of partnerships and relationships in ways that we had not had that before. So we work with other physician associations to make sure that we're exchanging information. Is this what you're learning? This is what we're learning, and putting that out there. And then we're also centering voices of physicians who are oftentimes racially marginalized, who we haven't heard from as often in the past, who have a whole different experience sometimes in context, because they are seeing oftentimes people of color and women of color.
Yeah, Aaron, I think that Dr. Maybeck makes a very interesting point that we learned during COVID about the stay-at-home order being nuanced, because we had to come back and make it very clear we don't want you to stay at home if you need to go to the doctor because you feel like you're having a heart attack,
right,
or you're having other symptoms that require emergency attention. We don't want you to stay at home and not go to your prenatal visits, or perhaps you can do it on telehealth, but you need to learn how to connect via telehealth. We don't want you to stay at home when your infant needs her 6-month visit, or that vaccine that comes at 12 months or 2 years.
Yep.
So all of those messages, I think we've learned a lot in the COVID environment. Our hospitals learned a lot by saying, yes, we want to make sure we have a sterile environment, but we're okay. We're doing all of the things that we're supposed to do. We have the PPE, and it's safe for you to come in for treatment. Our doctor, Dr. Nesbitt, likes to remind us that all of those ailments and illnesses that existed before COVID that we require you to go to the doctor, they still exist. And our healthcare system has worked very, very hard to be safe and ready for everything. I think that Dr. Maybeck also made a great point when you asked what voters need to be doing. And even for me, who's been in local government a long time, I'm seeing our public health system in a whole different light, and how ready and prepared they were for a pandemic. We always in local government prepare for the worst and hope it never happens, but we are experiencing something that our local officials and doctors have been preparing for, and they're doing a heck of a job. But we see what the things that we're missing. Stocking up on supplies, having those messages ready, making sure we can hit go on some very important messages that keep our community safe. And also what we've learned is what the interaction with something like shutting down your economy, sending kids home from school, where they have school nurses, where we have the ability to keep an eye on if they're safe and healthy. We've lost a major avenue to do that with kids not being at school. And so we are just learning a lot of lessons about how public health intersects with our local economy and our economic development efforts, with our public school system, and with other aspects of public safety. So all of these things are going to be lessons learned when we look back, when we built back to a more normal place. We're going to look back and have learned a lot about how our public health touches so many aspects of local government and the way we live.
Right.
And if I can just say, I think that the importance of community health workers has really had a light shown on it, because in one of my districts, which is one of the worst in the Chicagoland area, that's what has helped them they already had a few community healthcare workers that went out into the community, but that's helped them get the neighbors into the health center for testing and things like that. So I think we're going to see a growing field around that. And also, I just wanted to give a shout out to DC, because you also have to put up with people coming in and out of your city every week from all over the place. You know, I'm one of those people.
Well, we don't call it putting up with Congressman. We welcome you safely.
Well, you've done a great job. I just want to say that also.
And just can I build on one other thing that Congresswoman Kelly just mentioned? What is happening during this time is that we are seeing an increased demand for birthing support from doulas across the country. And, you know, I'm of a physician organization, and most physician associations definitely recommend, you know, for birth and birthing to happen within the context of healthcare institution and in hospital. But we're very clear, and the evidence does show that support from doulas and birthing coaches do help Black women especially, and especially when they come from our communities, and they help support in these times of just asking questions, but also support in helping to advocate as well. So I feel as well, in addition to community health workers, you know, there's kind of this broadening of also supports around birthing that's also happening. And then the other piece, you know, in Chicago, you know, Congresswoman Kelly, AMA headquarters is located there. And so we've been working very closely with Westside United. And, you know, it's a community kind of infrastructure. I would imagine, Mayor, that you have the same situation in DC that was set up before COVID even came around, right? And then having the opportunity to kind of capitalize on that community strength and asset in order to respond rapidly, I think has been really useful in many cities across the country as well.
Yes. I love what you're saying there, Dr. Maybank, because yes, I think that what we are learning here in this maternal health crisis is that Black women need all the help they can get, right? In terms of you know, having that having advocates, you know, for them to counteract some of the disparate treatment that they are getting in this process. Mayor Bowser, I want to come back to you as we kind of start to look ahead and think about some of those lessons learned that you mentioned. So with all that we know is at stake here, what can you talk about what steps the district has taken to really improve perinatal health outcomes, and in what ways residents are kind of tangibly experiencing those efforts?
Well, thank you for that, Erin. We've talked a little bit about it, but one, we take very seriously our national voice. We host this conference at the same time as the Congressional Black Caucus's legislative meeting, and we do that purposely so that we can invite Congresspeople like Congresswoman Kelly to come, because they have a huge role to play in moving the national agenda. After our first summit, we created Thrive by Five, which is an executive office in the mayor's office whose purpose is to coordinate among all of our agencies that touch women and kids and make sure that they have the budget resources they need, they're moving the legislative agenda that we need to get done as well. Our Department of Health, led by Dr. Nesbitt, who taped a greeting for earlier, has also drilled in our heads that we have to talk about before birth, during birth, and after birth, and focus on well women. And well women have healthier birth outcomes, and focus on that whole continuum of care that are serving
moms and babies. And finally, we are very focused on what I said, an integrated system of care that includes local trusted messengers and providers, all the way up to specialized maternal care and hospitals filling the gaps where we have them in our underserved communities. Our partnership with Howard University will include, and I know Dr. Frederick is going to be on a little bit later, will include a center of excellence, and in fact, 6 centers of excellence, but one of them will be focused on maternal care, where we have the opportunity to have some rich research on all of the things that are impacting the health outcomes of Black women.
That's great. Congresswoman Kelly, I want to come to you. You mentioned the legislation that you have around maternal health. I want you to tell folks a little bit more about that legislation and kind of where it stands now, but also just talking about in this pandemic, address, what you are trying to do to help address some of these disparities around COVID and minority communities, including around the issue of maternal health.
Sure. Well, the legislation, the first one was the Mamas Act, and it was a comprehensive piece of legislation that dealt with different aspects of maternal mortality and morbidity, looking at best practices. Why does it happen more in some places than other places? Establishing a review committee. Something Dr. Maybank said, I don't like this word, cultural competency, but you get the idea, what we're trying to say, to extend Medicaid to 1 year instead of just 2 months after having a baby. 70% of women do have some issue mentally or physically, and oftentimes it's after the 2-month period, and at least half, if not 60% of babies born, Medicaid is used. So we took that part of the Mamas Act and put it into the Helping Moms Act, and that actually was included in something Nancy Pelosi did. So that passed out of the House. But as I said, prior to that, I could not get one of my colleagues on the other side to be a part of the Mamas Act, but they did help with the Helping Moms Act, and that's extending Medicaid to 1 year. We would incentivize the states to do that, and they wouldn't have to get a waiver from HHS. So hopefully one doesn't pass the other, but we're still working on the other one. And I know you asked me, what are we doing now? I'm the chair of the Congressional Black Caucus Health Brain Trust, but I'm also on Energy and Commerce on the Health Subcommittee. And actually, Congresswoman Yvette Clarke and I actually started a racial disparities working group from Energy and Commerce. We thought we were just working on health, but then we were told, no, don't just work on health, work on the environment, work on energy, all the ways where there are racial disparities. And as was said already, it's just a system of racism that we face. So we're trying to knock down, all of those walls. But there's different pieces of legislation that myself and other members of Congress have to really deal. I won't say once and for all with the racial disparities. We know we can't snap our fingers and that it'll go away overnight, but there are different bills in the hopper. And again, we know that those bills may not go anywhere before November 3rd. So many bills are hung up, in the Senate or Mitch McConnell's desk, but perhaps, who knows? We have a shot in January to face down some of these issues of racial disparities. And there's so many, yes, we know about healthcare, but again, the social determinants of life are all a part of it also.
Yeah. Yeah. Well, as the mayor mentioned, we certainly would have been all in Washington together for CBC this week. So definitely want to talk about legislation and policy in this conversation. Dr. Maybank, the Congresswoman mentioned racial disparities, and we know that there are racial disparities in COVID and with respect to maternal health. There isn't much data on pregnancy and coronavirus, but we do know that pregnant women are more vulnerable to severe cases of the virus. And I'm wondering if you can talk kind of about what that, why that is, and the need for more data around pregnancy and COVID.
Yes. So yes, thanks for the question. So what we do know, so far, and this is really from the CDC's information is that there are about 20,000 or so cases COVID cases among pregnant women from the time of January up until about last week, and about 44 deaths. When you look at the race and ethnicity data, so far what they have, the highest rates are among Latinx people, then whites, and then Blacks. However, the important thing to note also is that this data is not complete. And this is the challenge of data collection really across the country, that we don't have enough data about pregnant women just in general, because that's just not being collected, and COVID tests aren't done on everyone as well. And we know that our systems to collect race and ethnicity data are quite lacking still across the country. And we've been working with Congresswoman Kelly's office. Mia Keys, who is at the Center for Health Equity, has worked with Congresswoman Kelly in the past, has really been a strong advocate to make sure that we as AMA are really using our voice in this space to strongly advocate that we need better systems, we need better data. If folks aren't counted, we cannot tell exactly what is happening, and it's really critical in a new and novel virus such as corona. What we do know, that pregnant women who do have COVID, that they tend to be, if they get sick from COVID, they tend to be more likely to be hospitalized, as well as an increased risk for intensive care unit admissions, as you already mentioned. No difference so far that we're seeing in deaths between non-pregnant women and pregnant women in terms of COVID. And the severity of it, why? We still fully don't know, because we still fully don't know enough about COVID. But possibly, an immune system related changes, the things that really trigger and create the severity for COVID in a non-pregnant person is the same thing that would happen really in an individual that is pregnant as well. So there's a lot to be learned so far. What we do know is that when a woman does become severely ill with COVID, and if she does, she's definitely at an increased risk of having an early delivery or birth, or at increased risk of a fetal death. So it's very serious and very important that we watch. But again, there's still not enough data. We need more data. We need more accountability to data in policy across this country.
Yeah.
If I just jump in, that was one of the issues that we saw. So we passed legislation that the president actually signed to get more and more accurate racial data from the CDC. They did not do a good job with their first try at it. They just had 3 pages of links for people to go to. But we wanted to know who got sick, what age, what race. If you were sick, did you go to the ICU, or were you sent home, and all of those things we were trying to find out. But the problem is also a lot of the states don't have the same recording mechanisms, or don't even record it. They have 2 different systems. So we have to look at putting resources together so that everyone is operating, from the same system.
Yeah. And I will just add, from my newsroom, we've been completely frustrated by the lack of information around gender, period, around the pandemic, both from the public health and the economic, crises. I want to close our conversation with a question that I'm going to put to all of you, and that is, actually, it's a twofer. So, one takeaway from this pandemic that you would say we could use to improve outcomes for pregnant people and babies. And then the other part of it is kind of, where do we go from here? What encourages you, and what also continues to kind of frustrate you about where we are in this conversation? We can start with Congresswoman Kelly.
I think just the numbers of people that have died. It's just unbelievable. And what's frustrating to me, and of course, I'm not just talking about pregnant people, but if we would have done more sooner. I know we didn't know everything about this is a novel virus, but I think, we could have prevented, some of the deaths. And what frustrates me now, that I feel as a member of Congress, we're trying, but we could be doing more, to help people. And I'm saying that as a person that lost a family member to COVID. We had no idea, that my uncle had it, no idea at all. He went to church with 60 members, a small church, and 16 died from COVID. And they followed, they closed the church and they were supposed to and all of that. But what gives me hope are people like Dr. Fauci, our organizations like the AMA, like things we're trying to put together, in Congress, and seeing places that were so ravished, I guess, like the New York, like the New Jersey, and seeing that if you follow what the doctors and the scientists say, that there is hope. We can get, past this.
Yeah. Dr. Maybank, I'll come to you next.
Yes, I think a couple things. I think the strength and persistence of racism and white supremacy to really hold these fractured and dysfunctional systems in place is something that becomes just more and more obvious. And it becomes obvious because there have been women and Black women who have been leading this call for a very long time. Black Mamas Matter Alliance and the National Birth Equity Collaborative, Joy Career Perry and Monica McLemore and many other Sister Song, have been saying, we need to listen to Black women. It's not new. And I can see that relative to now to kind of the strength and persistence of racism and what we need to do when we're larger organizations and powerful organizations like AMA, and how we really need to use our voice in support of and in advocacy as it relates to supporting Black women and saying that this is not right, it's unjust, and all of these things are absolutely preventable. And I think that is a role that we have to move forward even more and really also start advocating for those policies that are more about, the social determinants of life and moving more upstream as it relates to, universal health care, however that is achieved, things related to paid family leave, absolutely critical. And I think our overall, narrative in this country needs to be more rooted in, a human rights value, and that health is a right that everyone deserves, so that they can have access and they can have the opportunity to have the power, the resources, and the conditions to achieve optimal health. I feel like that's the direction we need to go, and where the hope is going to lie. And it's going to lie in all of us, coming together and continuing our multi-sectoral work that we know is absolutely critical to achieve collective outcomes and impact.
Yeah, Mayor Bowser, I'm going to come to you last, but I also want to ask, with the district being a sanctuary city, the issue of how maternal health and COVID is affecting immigrant moms where you are. If you could address that too, in talking about kind of where we go from here and the hope and challenges that you have, and also your takeaway for how we can improve outcomes around this issue in this pandemic.
I appreciate you asking that question. And you might notice that I have on two flags today. One is our flag, the American flag, and one is that of El Salvador. And we are sister cities to San Salvador, and we have a great number of Salvadoran residents in Washington, D.C. Today is their Independence Day, but it is also the day where many of them are waking up very scared of their futures because they're protected by the temporary protective status that the Supreme Court has further called to question in the Trump administration's actions. So we are thinking about them and other communities, Guatemala, Haitian communities that have the TPS currently and are worried about their future. We in our city want every immigrant, all of our residents to know that our local government serves them too. And we have really been in the forefront of providing health care, managed health care to all of our residents, regardless of their status. So we want to continue to do that. But our job, even though we have great healthcare and great access, is made harder when they fear the government. And they may not distinguish between, down the street and their local government. And so we just continue to call out to people that your kids can go to school, you can go get emergency care, and you can get
regular care because you can get insurance in Washington, D.C. So our D.C. residents and taxpayers have invested in that, and it is one of our values as D.C. residents. But you raised earlier and highlighted that more Black and brown people are getting this virus and dying from this virus. That is our experience here in DC, where we have over 70% of fatalities related to COVID are African Americans, where we see the rate of infection is higher among our Latino population. But what we're also saying when we say those numbers is that more Black and brown people are in essential work and can't stay at home and can't always protect themselves from exposure. And so how we come out of COVID is certainly a health issue, but we come back better from COVID if we have more equal access to good paying jobs and good food, and more people are on a trajectory to be able to afford a great quality of life in DC. So that's what we keep our focus on. I'm very optimistic about what we're learning about people getting access to healthcare in different ways. COVID has also exposed the lack of internet access that divides cities and divides the United States. And I'm looking at my sister, Congresswoman Kelly, and saying, please, in the COVID response, make sure that we're dealing with how to close the digital divide in our country. Because we know not only is that affecting schooling, it can have, in my view, a tremendous impact on people being better connected to healthcare providers and following their health as well. We're taking some steps here in DC of connecting our kids to the internet, but we know that we can also strengthen the infrastructure of our cities. And in doing that, you attract investment and you put people to work, which is going to help us come back better from COVID. So all of those things we're thinking about as we try to get our kids back to school, get our downtowns open, get people back to work, and bring our economy back.
Yeah.
We're almost out of time, but I know Congresswoman Kelly, they're calling votes. So can you stay with us or do you need to leave us?
I need to leave. I just want the mayor to know that we have a bill, the Moving Forward Act, that deals with infrastructure, and it's the infrastructure, roads and bridges, but it's also the hospitals, healthcare, broadband. I have a part of
all of those things.
Yeah, education. 40% of the people can't get online because they don't have the broadband capacity. So that hurts. My other area of interest, telemedicine. And so I'm with you. And yes, if you don't mind, I need to scoot.
We certainly understand you have a job to do. Dr. Maybank and Mayor Bowser, you with me? And thank you, Congresswoman Kelly, for joining this conversation.
Thank you. Thank you.
Thanks, Doc.
Mayor Bowser, I'm glad that you mentioned El Salvador today, the start of National Hispanic Heritage Month. And so, that is certainly important. And you also talked about the reopening. And I know we had a question, pertaining to that with the issue of early learning and development, which is also critical. So can you just speak to the commitment to quality childcare and support for babies as critical connections to the health of babies?
Well, absolutely. And we are incredibly invested in early child care in DC. And I guess now for more than 5 years, we've had universal pre-K in Washington. So children 3 years old can go to school, go to our public schools in Washington, DC, which is a huge benefit, not just for their parents, but we think for their lifetime of learning. We also know, though, that high quality childcare and affordable childcare is very important to how we attract and keep parents in DC. And it's also been highlighted during this COVID process. For example, in the early stages of COVID, we shut down just about all of our child care centers and had to open emergency centers for our healthcare workers and essential workers. And bringing those child care facilities back in a safe way where There's PPE and there's testing and there's social distancing is also going to be critical to bringing everybody else back. And we're very focused on how to get kids back in school in DC now. And we're hopeful that our residents and businesses will keep doing all of the right things that keep this virus contained in our city, so that by the first part of November, we will have hybrid in-person learning.
Yeah, we absolutely are all hopeful for that. Well, listen, I want to thank our panelists. This has been a robust conversation, very informative, very insightful. And I want to thank everybody who tuned in today and just remind you all to please stay safe and healthy. Remember to wear a mask, remember to take precautions to protect yourself in what is, for now, our new normal. Have a great afternoon, everybody.
Thank you.
Thank you. Bye.
There's a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
Ah, good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or are not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and No one can do anything with them. And they come in and I'm going, really? This, like, the kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfasts and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
We've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting. And you
may have heard, moms matter to me a lot. That's why I founded the What to Expect Project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit. Because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible, and more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures, and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development, and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, you know, this is what she should be doing at this age, and it calmed our fears a little bit.
I would have to say my favorite resource of the Learn the Science Act Early would be the app. But having the app readily available has honestly been great, and it's been awesome just seeing her development and growth. The Learn the Science Act Early app is actually very easy to use. I can access it right there on my phone, and whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Science Act Early super user. The Learn the Science Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Science Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
You know, I want to know if maybe she's lagging farther behind than she really should, and it's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Science Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
There is a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible healthcare, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoyed the name.
Come on, everybody.
It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They helped me a lot.
When you teach at this age, they grasp things like they're sponges. It's just amazing seeing him like grow. Like he loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee Jumpstart is a special place for me because they gave me so much courage, wisdom. It was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in, and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
All good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk?
Please welcome back Dr. Faith Gibson Hubbard, Executive Director of Thrive by 5.
Good afternoon, and I am so excited that you have stuck with us after our first panel. I hope that you are now excited for me to introduce to you our second panel, Understanding the Root Causes, the Impact of Trauma on the Life Course. The moderator is Dr. Wayne A.I. Frederick, who is the president of Howard University, Dr. Deidre Cooper Owens, who is the director of Humanities in Medicine program at the University of Nebraska-Lincoln, Dr. Benny Choshi, co-medical director for Healthy Generations program at Children's National Hospital, Dr. Amanda Lattimore, assistant scientist, Department of Epidemiology at Johns Hopkins Bloomberg School of Public Health, and lastly, and importantly, Dr. Zaya Malawa, director for Expecting Justice at San Francisco's Department of Public Health.
All right, thanks everyone. Good afternoon and welcome to this panel 2 discussion. We have some distinguished guests with us. And what I'll do is, as I call everyone, I'll have them give a short introduction of themselves as we move forward. This is obviously a very critical topic at a critical time in our nation's history. And I certainly want to start off by commending the mayor and her team for putting this together at this very, very important juncture. This is an issue that we should all be aware of, and not just aware, but be proactive about being part of the solution. And so I certainly have the distinct pleasure to be with such an august group today to discuss this. What I'll try to do is to keep this moving, but we'll go around first and start with some introductions. I'll start with Zia, if you can introduce yourself briefly, and then we'll go from there.
Hi, thanks for having me. My name is Zaya Malawa. I'm a pediatrician and a public health practitioner in San Francisco. I work for the Department of Public Health in San Francisco, and I run a program called Expecting Justice there, where we look at how we can address racism directly as a root cause for birth health inequities. Thanks.
All right, Benny.
Hi, everyone. My name is Benny Choksi. Thank you so much for having me. I am also a pediatrician that works right here in Washington, D.C. at Children's National Medical Center. I'm an adolescent medicine physician mostly, and at Children's, I've run a Healthy Generations clinic. I'm one of the co-medical directors for that clinic, which is a medical home for parenting teens. And we really try and infuse our clinic with a trauma-informed approach to create a medical home for these teen parents and their families.
All right, Amanda.
Hi, everyone. Amanda Lattimore. I'm faculty in the Department of Epidemiology. I'm a social epidemiologist, and a lot of the work that I do involves providing technical assistance to public officials across the U.S. on the overdose crisis.
All right, and last but not least, Dr. Cooper Owens.
Hi, I'm Deirdre Cooper Owens, and I am a historian, a professor, and I also am the director of the Humanities in Medicine program at the University of Nebraska-Lincoln. And I'm also the director of the program in African American history at the Library Company of Philadelphia, the country's oldest cultural institution.
All right, and I am Wayne Frederick. I'm the president here at Howard University. I'm also a practicing GI surgical oncologist. So we'll jump right in. One of the issues, obviously, today, as we look at the issue around maternal health, is the issue of trauma and the role that trauma may play in a pregnancy and also both pre and post in terms of the relationship and how a woman may view herself and be viewed by the folks around her. So maybe we could start with you, Dr. Malawa, about what you see and what your thoughts are about how we even define what that trauma looks like.
Thanks. So I think, historically, stress is one of the very few things that we can say definitively is causing these premature births that we're seeing so disproportionately in Black women, Indigenous women, and certain other communities of color. increasingly, research is indicating that it's not just stress, but specifically racial stress has a causal relationship, meaning that it can be now seen as a cause for some of these birth inequities. And so I think that trauma, yes, as a whole, but in particular, we need to think about the trauma of experiencing racism and some of the economic, financial, and educational manifestations of racism as a major driver of some of the birth inequities that we see.
And Dr. Lattimore, just to build on that, the constant weathering that some of these structural inequities cause can manifest themselves in so many different ways. What are some of the ways for those who are listening today that you see that in the work that you do, and any other issues that you think we should elucidate here as we talk about the trauma and that stress?
Right. Well, some of the systemic cross systems impacts that Dr. Malawa talked about have very important consequences for people's health long term across the life course. So that chronic exposure to mass incarceration and lack of resources and food insecurity, that leads to what we call allostatic load, which affects the immune system and long term can produce higher rates of cancer and autoimmune disease. So for every traumatic exposure in childhood, you're looking at a 20% increase in autoimmune disease. Cancer rates are higher, type 2 diabetes, and substance use disorder is another important long-term consequence.
And Dr. Chokshi, you probably see this in terms of what types of developmental issues children may have, as well as their social, not just their physical development, but their social development and the impact. And as well, when you look at the rest of the siblings or even their peer mates in terms of the environment that they may be in, what are some of those manifestations you tend to see?
Sure. There are challenges with emotional regulation and memory, performance in school. Obviously, all of the systemic issues impact a child's ability to attend school in the first place. You know, right now we're talking about COVID, there's the digital divide, an inability to actually participate in school obviously leads to, increasing the inequity for education. So all of those things combined can really challenge the development and youth being able to hit those milestones.
And Dr. Chokshi, anything you want to add to that as well?
Yeah, I definitely agree with that. And I also just wanted to, point to, I see it in kids for sure, but in my teen parents, the literature has shown again and again that teens who have unintended pregnancies, and the unintended is important there, have had disproportionate rates of exposure to traumatic experiences. And I think that is really important for us to understand in order for us to be able to take the best care of our youngest mothers, that their pregnancies develop within a context of adversity at times. And in order for us to best meet their needs and to help their stress levels and to help the developmental outcomes for their children, we need to recognize that and respond with a trauma-informed approach. And so I agree with Dr. Lattimore. I see those developmental outcomes in the children that I see, but I think it's important to even go upstream and recognize the ways in which they are, being rooted.
And since you touched on the issue of teen mothers and teen pregnancy, what are some of the things that we should take away from the impact of trauma on those young mothers, as well as you made a point about unintended pregnancies versus planning. And I think that's a critical point, especially when we think about teenagers as well. What are some of those factors and their own long-term outcomes and potential after having a child at that young age?
Yeah, I will try and make just a few points. I think I could probably overtake the panel talking about how we could talk about teen parents, but I really appreciate the question. And I think the one thing I would say is that I do a lot of work with respect to trauma-informed care and educating my colleagues, medical trainees, interdisciplinary health professionals, community members on what approaching patients and clients and families and communities with a trauma-informed approach entails. And that's really thinking about reframing from thinking about what's wrong with somebody to instead what happened to them. And that's so tremendously important across the board with respect to healthcare, but with teen parents specifically, because there's so much misunderstanding, there's so much judgment that comes their way. And as a result, the healthcare that they are offered can be suboptimal, and they also access healthcare less because of the lack of respect that they receive. And so I think it's so important for us to recognize that if we are going to meet the needs of our youngest parents, we need to meet them where they are and provide them with the same respectful, patient-centered care that we provide everyone.
And I'll just add to that and extend this, what happened to you, to what's right with you, is an approach where we're not pathologizing people for their trauma, and recognizing their assets and bringing that to the table in our response to the trauma.
And I'll just provide something a little different. We've had reason here at Howard to look at the outcome of students who come from single family homes, predominantly single mother homes, and they actually tend to do better than our two-parent family homes as well, which I think speaks to the resilience of Black women. And so that takes me to Dr. Cooper Owens. Resilience is something that often is discussed when we discuss this topic of maternal health. It's kind of in spite of what is occurring around us. What are some of your thoughts about the basis of that resilience? And as we look forward as well, what are some of the things we should be thoughtful about as we examine structural changes that we can put in place to be more supportive?
Yeah, thank you for that. Often I joke, I said, I sometimes feel like an interloper because I wrote a book on the history of racism, gender, and American gynecology. And so I sit in a very different world. It's a humanities world and not one that you all sit in, which is the medical world, but medical humanities has brought me in because people are really interested in how did we get to this place of maternal crisis, but in particular, Black maternal crisis. And so, you know, like many things in this country, it starts from a space of anti-Blackness. When we see the ways that, in particular, Indigenous women, but also Black women, most of whom were enslaved when they were brought to the Americas, unfortunately, that literally sets some of the foundations for how the medical industry was created. And so all of a sudden, you start to have a very particular way that doctors see Black people and white people, men and women. And even laws are then changed around the ways that Black women have been exceptionalized. So for instance, a child inherits the status of the mother if that mother is enslaved. And that goes against everything that European colonists had brought. So the resilience comes in the form of how does one heal in the midst of trauma, even if you don't have the language to name it as such. And so you build community. So whether that's by blood or, you know, it's an old school term, but I think a lot of people are familiar with it, with fictive kin, but you build community, you build kinship. You are able to hold on to and to tweak some of the traditional ways of healing. And so the things that we tend to now call music therapy or art therapy, these people were infusing in the midst of their own healing. And so that's the resilience. I think as we move from that period of the 18th or 19th century, what you started to have in the late 20th and in the 21st century is a democratization that happens within medicine, but also within the academy. And when that happens, you start to have people who center subjects who look like them. And so it's not surprising to me that many of the panelists here who are pediatricians or epidemiologists are Black women or women of color. And so we tend to focus on those populations because we saw that there was a dearth of studies and research that were being done. And so when we started to pivot the conversation to focus on patients, you start to come from a position of, maybe it isn't race that's wrong, but it's racism that's wrong. Maybe it is a way that we can move from patient blaming to a more holistic view of healing. And so I think the resiliency comes in where we now have a kind of widening of the scope of what holistic and effective healing measures actually mean.
And just to piggyback on that, because I think as you make that very, very critical point, I think it's important for us to understand the history of it. But as we go forward, I think it's important for us to understand how we control those. And I would say, very openly here at Howard is an example of something that we have to change. We've had 17 men as presidents, including myself, and hopefully I'll be the last before my successor. 70% of my undergrads are women. When I started, one permanent female dean of 13. We now have, and we've gotten up to as high as 10. But clearly, part of that also is the structure system. We have a mayor who is a strong advocate for women and for maternal health. And so when we look at that, what are some of the things in our health system that you see us doing as we go forward? You look at the project that the mayor has sanctioned in Southeast DC and bringing obstetric and pediatric care there is a critical, I think, piece of laying the groundwork. But based on what the resilience has been built up, what do you see going forward as key initiatives that must be undertaken?
Ooh, I don't know if a local person. I am a Southeast DC girl. I grew up.
That's why we're asking you. And you're not an interloper, by the way, because the humanities are critical to what we do. So you're not an interloper. It's a backbone of what we do.
Yeah, thank you. I think what's important, and you know this, President Frederick. There are not a lot of Black medical schools. We have Morehouse School of Medicine. We have Howard. We have Meharry. And the sad thing is, during the era of segregation, we actually have more nursing schools and medical schools set up for people of color. So we have to be able to widen that. We are talking about a really white medical field. Does that inherently mean it's bad? No, because I don't believe in biological determinism. But what it does mean is that you have now had those people who are coming in more recently saying, wait a minute, the foundation is shaky. And so there are a few folk who are listening. I think the other part of it, we are in academia. I think 3 of us are attached to academic institutions. Most academia, largely white, 86% of PhDs are white, right? And so once again, here you had to have people who look like me, born in the late 20th century, who are writing about a past that wasn't even really a secret. It's just, I decided to say, instead of looking at the doctors and the hospitals, why don't we look at the patients, right? Because I had a particular focus on that based on my own training coming from an HBCU, being a Black woman, all those kinds of things. So I think a part of the structure is literally dismantling or excising, if I can use a medical term, excising those parts that are diseased, right? And being able to shape institutions that pay attention to the ways that these communities have been mistreated, how they are being harmed. So that means perhaps not providing healthcare based on a high income tax bracket for certain communities, not having doctors be switched out like temp workers in certain hospitals in poor areas, right? That sometimes people are like, I think I met with Dr. Jackson, but Dr. Jackson's at 2 or 3 other hospitals during the rest of the week. Those kinds of things need to be in place structurally. But how do we get that when the population is so small in terms of people of color who are in academia, who are in medicine? And so, that's kind of the I don't have an answer to. Maybe.
I'll underscore one of the things that we could do is support our local HBCU and University of the District of Columbia. So we can start there. I think, again, the mayor has done a fantastic job of supporting that institution and raising its stature, not just in the city, but nationally. So Dr. Chusky, I want to get back to you, because you deal with adolescents. So you kind of see the manifestation of the perinatal environment that you alluded to in the teen mother. But I wonder, in the kids, after they pass that infant and childhood state and they become adolescents, what is the psychological, the physiological impacts of some of that trauma that you may see manifest itself in adolescents who come from a circumstance where they've dealt with that trauma, their mother's pregnancy was traumatic for the social reasons that we've mentioned. What are some of the things you see manifesting in them as adolescents?
I am very excited to answer that question, but just for the prior question that you asked, I also wanted to say part of the answer is including our patients and families in the solutions that we are trying to, in the brainstorm sessions for the solutions that we are trying to find, couldn't be more important. So many of us sit in a room, try and think of what might work, but truly the voice of our patients and families is not being brought to the table enough. So I just, felt like I would be remiss if I didn't say that. So apologies for adding my own thoughts.
No apology. And I think, again, kudos to, the district and the mayor's office for putting on something like this. I mean, we have to have these conversations in order to be able to bring that out and to the forefront. So I think your point is well taken.
Yeah. And in terms of the adolescence, adolescence is so interesting because it's a time of sensitive neurodevelopment that can almost be as sensitive as the early childhood years of the 0 to 3 years. And to answer your question, anecdotally, what I see is a myriad of things, truly. So, mental health is a big one. We see depression, anxiety, and we see patients who come to have a evaluation for ADHD. And really, if you ask the right questions and sit down with the patients and really take time to understand their experience, you recognize that what they may be manifesting are really symptoms of PTSD. There's such an overlap between ADHD and PTSD. And, that's something that I'm passionate about, is really making sure that we are helping our patients and diagnosing them appropriately and factoring in trauma into the differential diagnoses that we have. We see it in, difficulties in school, difficulties in peer relationships. I already mentioned unintended teenage pregnancy. And so I think really across the spectrum of pediatrics, but also adult medicine, it's that idea of being mindful of trauma and recognizing. I always advocate for universal trauma precautions. And so I'm not a big fan of screening for traumatic exposures. I think that this is the way that we should practice healthcare across the board for all of our patients in every sector. And so I would say that the same holds true for adolescents as it does for younger kids, but also young and older adults.
Dr. Malawa, with that in mind, what are some of the interventions that we could put in place early on, and how early can we start putting those interventions in place in order to help the healing process and to ensure that some of the long-term effects that we just described do not manifest themselves?
Well, to answer that, I just want to kind of go back to looking at adverse childhood events in particular. And when we look at a lot of the adverse childhood events that have been most studied, so many of them are impacting people of color differently because of racism. Like, for instance, one adverse childhood event is if you had a parent who was incarcerated. But if you are of a community like Black and Indigenous people, Latinx people that are disproportionately incarcerated in this community because of racism, then racism is literally producing adverse childhood experiences for these kids. I worked at the Baby Child Health Center, which was a clinic that really looked at adverse childhood experiences for many years. And we would find a lot of moms who would get a trauma screen at the beginning of their visit and then kind of name that, I know that I have my kid in an unhealthy living environment, but I don't have the financial resources to move. So what am I supposed to do? And again, these are mothers who are people of color who are disproportionately impacted by economic alienation. So they don't have the wealth or the income to be able to make moves to protect their kids from what can be really hard living situations. And so when I think about interventions, like, yeah, sure, therapy and stuff, but what the critical intervention here would be to address racism, frankly. And I think that we as a medical community are very reluctant to do that. The health officer of New York City published a commentary in the New England Journal of Medicine in 2015, where she basically did a search across the entire journal for articles that mentioned racial health disparities. And she found something like 450 articles that mentioned racial health disparities. But of those, only 15 mentioned the word racism. And of those, 6 were book reviews. And I think that goes a long way to kind of explain how we in this field are very comfortable naming racial health disparities, but we are not comfortable naming the root cause of racial health disparities. And so we spend a lot of time, building resilience and providing therapy after the fact, but we really need to think about this from a preventative perspective, I think, because A, it will be the most effective way to deal with this, but also it's the only ethical way to deal with this. Like, if we are seeing that racism is literally taking a lifetime toll on kids of color, then there's only one right thing to do, and that is to stop being so darn racist.
All right. So with that in mind, and I think that that's not just compelling, but forceful. This morning, I read an article from the New England Journal of Medicine about racism in sickle cell. And as a sufferer of sickle cell myself, I'm homozygous for sickle cell. I was stunned that this was published in the New England Journal of Medicine. Pleasantly stunned. I've probably read it twice already since this morning, and intend to read it again tonight for bedtime reading, because that is not an article that I expected to see there. And I think it goes to the very point you're making. So with that in mind, Dr. Lattimore, what are some of the things when we talk about the systemic racism that creates the environment specifically that our listeners, that even the mayor's office could take away from this to say, this is something that we need to go change? And also public health officials all around the country, what are some of the things that we can say to them today? These are the things that you can begin doing this afternoon to start impacting exactly what Dr. Malawa, I think, has highlighted, and appropriately so.
Right. Well, we are in the midst of a social justice movement. So I think it is, the stars are aligning for us to do something about mass incarceration, police brutality. Black communities are over-policed, brown communities are over-policed. And they're 10 times more likely to be arrested in some locations, 3 times more likely to be fatally shot in police encounters, despite the fact that they're less likely to be, carrying contraband or carrying a weapon. They're highly impacted. So, I'm of the opinion that there's health in all policy. And if we can change some of those policies that reduce over-policing, reduce incarceration of our Black and brown communities, then that directly relates to health. It keeps people employed. Once you get incarcerated and you get in that cycle, it's hard to get employment, housing, food security, and all of those things trickle down into maternal health.
So with that in mind, the very practice of medicine, based on what we've already heard in terms of the biases that people bring to the table when they interact with the patient population, is part of the issue. And we're in the middle of a pandemic, as you rightly pointed out. There's a social justice issue. Is there something or some things that you have observed, Dr. Chusky, that is occurring right now that you're concerned about, that may be accentuating the very trauma and some of the outcomes in this moment that we should all be aware of and ultimately be trying to prevent, and not wait till after the trauma, as Dr. Malawa rightly pointed out?
I'm concerned about many things, but specifically with regards to this, I think it's really important for us to recognize that COVID-19 in itself represents a community trauma. It is a period of uncertainty. It's a period of loss of control. People don't have any sense of safety, and those are the exact characteristics of a traumatic exposure. And certainly, to go back to the definition that Dr. Malawa gave in the beginning, trauma is subjective. We cannot state for our patients or their families that something is traumatic for them, but just from a community standpoint, as a pediatrician, I can see the effect of this community trauma on our patients. And so I think that we all, as a city, but also as a nation, have to factor that into our response, to recognize that across the board, people are unable to access the things that keep them well. People's jobs are at jeopardy. They can't access food. Community resources are limited. Mental health access is limited. But on top of that, this is felt greatest in our patients who may already have a history of other adversities, because then you have this traumatic exposure being layered on top of a history of trauma that already exists, which is an even more dire situation. And so if we want to respond to this, we really have to recognize it from that perspective, and we have to take care of each other. And as healthcare institutions, we should be willing to do that and recognize that COVID-19 is not just an infectious disease. It is a pandemic, and many other pandemics have had much data that has come out of them years later showing the traumatic effect of the pandemics. And so if we want to meet the needs of our patients and families, we have to recognize that. And then if we recognize the social justice movement that's happening concurrently, we need to recognize that this is a perfect time for us to right some of our wrongs and really take action to build strengths, build resiliency, and help individuals access the care that they need and the resources that they need. And for me specifically in my practice, I just see over and over the need for supportive mental health services. And if I were to make one request to, our mayor, it would be to help our patients access mental health services, because it's such an investment in society, and the dearth of resources is really alarming and upsetting.
I would argue we are in a trifecta of epidemics between COVID, racism, and the overdose crisis. We really have an opportunity to also provide, in addition to mental health care, greater access to medications for opioid use disorder and other therapies for substance use disorder.
Yeah, most certainly. And I think with that in mind, Dr. Cooper Owens, my mom lost her husband, my dad, a month shy of my 3rd birthday. And I have a younger brother as well. So she had 2 very small kids when that occurred. And as we discuss this topic and we think about the pandemic and how many, and disproportionately affecting African-American populations, in which family structures are being broken because of the deaths that are taking place, and also the long-term effects of having COVID. The Black woman still represents, in my opinion, the core of the universe. Definitely, it still is in my universe, and it's going to be in our community's universe. And having to carry that burden is obviously accentuated with what we've heard here. We talk about incarceration. Clearly, African-American men are more likely to be incarcerated, but who do they leave behind to carry that burden? When we look at those things, and we were talking a bit about structure, intervention, making appeals for what should happen. What are some of the things communities can do themselves that does not involve legislators or does not necessarily involve the government? What can we do for ourselves? What self-love can we apply that would be helpful?
I love that last part of your question, what self-love can we apply? Because I think that love is the defining framework. Love is the methodology, right? So love becomes the practice that can help save us all, because from love emanates empathy and compassion and thoughtfulness. And these are things that are needed in everything that all of my esteemed colleagues just mentioned. So from mental health care to a new way of thinking about substance abuse or overuse, right? For raising our children. And so for me, it kind of, because I'm the historian, I'm always like, wait, there was a blueprint left. I promise y'all, it ain't hidden it ain't hidden. It's actually in a book. We just have to know which books to get. Right. And I do a lot of public speaking. People are interested in the history. And I will tell them, guess what people did centuries ago that we're now picking up in the 21st century? They created mutual aid societies. They created benevolent societies. So there was no legislation. In fact, the legislation was patently anti-Black and anti-woman. And so these people were like, let's put our pennies, our coins together, and let's create a space so that we can bury our loved ones, so that we can feed our families and people in the community, so that we can educate our children. And so I saw that, especially during the beginning of this newest pandemic, in majority Black urban cities, New Orleans, out of Baltimore, DC, New York. I used to live there until last year, a number of mutual aid societies. I think that's important. I think the cultural institutions that sustain us become really important. And I don't necessarily mean formal ones. I love HBCUs. I went to 2 of them. But churches, I think social clubs, cultural clubs, the fraternal organizations, all of those kinds of things, even the informal spaces where we entertain each other. So when I think about music therapy, when D Nice, comes and plays music, right? That emanates from a South Bronx culture that was informed by people who came from the Caribbean, and they just wanted to feel good in the midst of a Bronx that was burning around them quite literally. And so he brings this to us in the best way we know how. So those are things that don't cost money. Those are things that don't require legislation. People are often saying, well, what are Black people doing? We are our own worst enemies. And I'm like, are you not seeing what we are doing every day to sustain ourselves? And so that's why I really thank you for ending that phrase on self-love, really as praxis. That's what we do. And it ain't new. We've been doing this for centuries. It's not new, right? And that's the most radical and revolutionary act. I do want to say, added on to what everyone else has said, and I know this is not surprising to you, this is about maternal and infant health. And we know that we're facing this crisis. I was shocked. This was in July. I'm going to do something with a healthcare agency based in Germany, but the medical director is a Black woman from the South, educated in the US. And she said, and I was just shocked, that on average, women of African descent have low-level inflammation at almost any point during the day. And I was like, so what does that mean? Because of the stresses that we face, unending, racism, sexism, a lot of isms, literally your body's trying to repair itself at night, but you have these low-level cortisol levels, all of these things. And I'm saying, my God, the fact that your body's supposed to restore itself during sleep, but it's also trying to fight off inflammation because of these stressors. And that's another point that Dr. Malawa was talking about with this kind of anti-Black racism that just seems unceasing. So I often end my talks by telling the good white folk in the audience who are like, Dr. Cooper Owens, I'm a believer now, what can we do? And I'm like, stop raising children who are anti-Black. Because the statistics show that when they're entering into medical schools in the 21st century, they literally believe things that were taught in the 1800s, 1900s. So stop raising people who are anti-Black and entrusting them to care for those who look differently or live in a different zip code. It really starts there.
So two things I'll say to tie that to Dr. Lattimore, because I'd love for you to comment on this. One is on that issue, and since you mentioned Germany, I had the opportunity to go to Berlin and meet with this young guy had put together almost like a book club in a I want to call it a library, but it was really like a one-room space, and they were interested in coming to Howard. And I got in there, and they wanted me to take a picture with them. And as I stood up to stand in front of them to take the picture, I looked over my shoulder, and there was a picture of Toni Morrison. And before I could articulate to them that she was a Howard alum, they gave me her entire bio. So one of the reasons I always speak that self-love is because I think that Black women can be so uplifting to one another and that role model, but we have to make sure that we do prize them in that way and that we do lift them up. And then to tie that issue, because I don't want Dr. Chusky to take this personally, there's an article in the American Medical Association Journal on unconscious bias, published a few years ago, and it looked at implicit bias. It took the starting medical students at Johns Hopkins, predominantly white, and posed different questions to them. One of the questions was a white woman, booth operator, and a Black man, lawyer, and it said which one is more likely to answer, to be able to sign an informed consent, to understand it and sign it. And the majority of that class, and I think that medical students, the day before they start medical school, are the most altruistic people. They pick the white toll booth operator, the woman, as opposed to the Black male lawyer. So there are inherent unconscious biases we bring to the table. Dr. Lattimore, with that in mind, what are some of the things that we can do to really combat the structural racism that exists, whether it's in our medical system or in our society, that ultimately will impact our medical system today? What are some of the things that we can get to address that?
Well, I think it starts with a conversation and listening with the understanding that you might be wrong. I think there is a lot of the way that we think about communities of color that we don't quite recognize are intrinsically racist. So this idea of resilience, it's a little controversial for me to say, given what we've already mentioned, but resilience is, instead of trying to build up resilience, it's a symptom of oppression, addressing the oppression itself, which was mentioned by Dr. Malawa, it is important, but then to recognize that believing in, well, you just have to work hard enough and you can make it. This idea of exceptionalism is a racist idea in and of itself. So it's kind of hidden. It's woven in between the way we think and talk about things. And it starts with a conversation and listening to those who've been impacted.
And I think with that in mind, Dr. Chokshi, when you look at things like post-traumatic stress disorder, ADHD, anxiety, learning disabilities that may occur, as we talk about the infants now, because we want to break that generational chain, right? And I'm going to get to Dr. Malawa on that point, but I want to ask you, especially because I want to go back from that late adolescent, thinking of going to college, having to start interacting with, partners, whether regardless of their sexual orientation, and what do they take from those relationships into that stage, and how can we break that cycle? And so whether it's a diagnosis that we know comes from that trauma or things that go unrecognized.
Yeah, I think a lot about how to break the cycle of the intergenerational transfer of trauma, particularly with my work in the Healthy Generations Clinic, because we have the privilege of taking care of parents and their kids, which is not something we often get to do in pediatrics. It's a really unique model. And for us, what we see is, and I was just listening to a talk by Roy Wade this afternoon, who's really a leader in this field of childhood adversity and trauma. And I think what we need to do is we need to create systems that support families, and we need for them to be trauma informed. And so trauma informed parenting groups is something that has really been coming to terms, and home visiting programs are also important. But when I say this, there's an idealistic effect to what I'm saying, because just because the programs exist doesn't mean that they're meeting the needs of patients and doesn't mean that they're accessible. And so I think I have to go back to my original point of involving our patients and their families, because I think part of what we have to do in all of this work is to talk with our patients and their families, and also help educate them on how racism may be affecting their health, and help educate them on how trauma may be affecting their health. Because what I've been finding more and more in the recent past, as I've been doing more and more research in this field, is that we as healthcare professionals are really sort of, galvanized by the research on trauma and the neurobiology of trauma and the effect on health outcomes. But when I talk with my patients about it, they have not heard about this. They don't recognize the connections. And I think it's a sensitive topic, and we really have to do it in a respectful way. And to date, I can only find one manuscript that talks about how to talk to patients about trauma in a respectful way. And so I would encourage us all to think about, in the individual work that we do, how do we help patients understand this connection? Because to truly partner with them, to collaborate with them, requires that they understand the same thing that we understand. And I think right now we could do a better job of doing that.
All right. And Dr. Malawa, as we start wrapping up, these are always great conversations. There's no doubt about it. But the surgeon in me is not going to allow us to leave here without making sure we give clear direction to our audience. I am a Black male living in the middle of the trifecta of this trauma. And as I said, the core and the center of my universe is a Black woman. What advice can each of you give to us as Black men to make sure that we are supporting making this better, making the life of the Black woman during and after pregnancy better, and also participating in making sure that family unit is also lifted up and better as well? So I'll start with you, Dr. Malawa.
Well, I guess what I want to say is that, I want to, again, acknowledge what Black men are working against. And I know that this is not at all what you were trying to imply, but very often I feel like Black men get pathologized for being absent fathers, when A, the data shows that in general, Black men are some of the most present single fathers out of any race group people. But B, they're up against some really hard structural racist issues in this country. And so, the first thing I just want to say to any Black men on the call is, like, you are enough. Like, legit, you are enough. And I wish you luck in dealing with all of the really hard manifestations of racism. As a Black mom who has a Black son, it has been really difficult to describe to my son in a way that keeps his spirit intact what all the social unrest is about. how do you start to talk to young Black boys about what has been happening with police and Black communities in a way that helps them feel excited and proud to be Black, right? And this is not anything new for folks who didn't know. This is something that Black communities have been dealing with forever. So I just want to start with saying that y'all are enough. But I also want to encourage men in particular. We live in this society where men are really encouraged to not engage emotionally. And what we know is that this society produces trauma for Black folks in particular and Black men in particular, and that trauma has an emotional impact. And if we cannot start to recognize the ways in which that trauma is impacting us, all of us, then we might run the risk of creating more trauma for other people around us, or just not even being able to show up in an emotionally present way that folks might need. And so I guess I want to say to all people who are experiencing marginalization to make space for the hard emotions that are happening right now, and to not feel diminished if you are experiencing hard emotions and can't tamp those down. And I just want to reiterate that we are enough.
All right, thank you. I certainly feel better, I got to tell you. I appreciate you articulating it in the manner in which you did, especially as a father of a 16-year-old son and a 14-year-old daughter. I think I get an opportunity every day to see the dynamic in almost every single thing they do, how differently people treat them based on gender and based on their commonality of race. So I think you make a very, very good point. Dr. Chastri, any advice as we begin to wind down?
Dr. Malawa said it perfectly, because Dr. Frederick, the first thing that came to mind is that in our generation's clinic, we often don't see dads engaged. And that's not because they don't want to be. And truly, if I'm being honest, it's because many of our services are geared towards the mothers. And so what I really wanted to say is that, you know, Black fathers are important. Fathers are important. We should all engage with each other. And, you know, we should proceed with love and from, you know, acknowledging each other's strengths as we do this work together.
And I obviously feel like I come from a different generation. You guys look like I probably did some 30 years ago, Dr. Cooper always. But when I think of this, my first child, I went to my dean and I told him I was going to take paternity leave. He's the father of 8 kids, and he looked at me like I had 2 heads. You know, what is paternity leave? And at that time, obviously, that was not something that was acceptable, so to say. You know, and it does reinforce the wrong type of stereotypes and behavior. You know, and to the points that have been made before, that's already a disconnection from my child and from my wife. That somebody else was attempting to impose. I kept my job and I went and was there for the for the birth, but it is an interesting perspective as well, and that we don't necessarily create in the medical services a space for fathers to participate. Dr. Lattimore?
I would add to this great list that Black men have a very important role with mentorship. And there's a lot of power and advocacy as well. So going out and, you know, identifying policies that are discriminatory, that facilitate inequity, and advocating, you know, there's a lot of healing just in that. And in terms of mentoring, our young people need someone who looks like them, who is successful, as something to aspire to for their future. So mentoring, I think, is another important component.
Yeah, and I appreciate that issue as well. I mean, I think the pillars of our society, unfortunately, are often overlooked because they live right in our communities, and they're not necessarily on our television screens or on our basketball courts or on our football fields. They're right in our communities, and we have to take the opportunity every time to lift them up. So I appreciate that. And Dr. Cooper Owens, you're going to take us home with the advice. Again, just to show you that you're not interloping here. Humanities is the backbone of the solution. I keep telling people humanities and social sciences, in my opinion, is the solution to our future, in my humble opinion.
And I agree. I'm not going to argue with you on that one. You know what? Everything you all have said it needs to be repeated from the mountaintops. So I'll add, I am sometimes really disheartened by two things. The adversarial positioning of Black men and Black women against each other. And it doesn't have to be that way. We all know that we are experiencing trauma and pain. And so just by acknowledging we don't have to necessarily compare, but how do we work together to build a much more intact and healthy community? And that encompasses everything that has been said, because the maternal and infant crisis is not just involving the people who are birthing children or pregnant, it's involving all of us, right? And so that's number one. The other is emotions do not need to be gendered. I'll just end very quickly. I lived in Brooklyn. And as much as I love DC, Brooklyn kind of took my heart a little bit as well. So and I lived in Bed-Stuy, and there was a anti-street harassment campaign started by a Black woman. And one of the pictures was of a Black man, and it said, "Black men can be soft." And I knew that it would have been tagged or destroyed by the next day. And I remember my husband and I drove by, and I said, look, they literally, whoever it was so offended by just the word soft that they destroyed soft. And I'm thinking, softness, empathy, compassion is not something that is biologically available only to women or women identified people. We're human beings. And so gendered emotions is a threat to our society. And I would just want men to lean into all of your emotions. That's what makes us human, and that's what makes us whole.
Yeah, well, again, I appreciate it. I appreciate your expertise. I think you guys have been absolutely fantastic. Your data, your information, your interventions are exactly what we need. I think this is a very, very important discussion. I'm going to close on a very, very personal level. My grandmother was a mother of 10 kids, and my mom, while the mother of 3 kids, had 4 miscarriages to have 3 kids. And in retrospect, she's a nurse. As she looks at the care that she got around her pregnancies, it wasn't directed at her in a way that would have allowed her to carry those pregnancies through. No interventions, no mental health support, no emotional support of any kind. That's just what women had to do, and you had to get through that. I was at the birth of my first child, and I remember my wife getting an epidural and someone commenting that, she was probably being weak by getting an epidural. And so it is a constant, ongoing situation that manifests itself probably right around the birth. But as I think pointed out here, it has a long history, a long tail to it, and it carries on well into the life that these children then live. However, there's a solution, and I do want to underscore what was said earlier. We all have the ability to love, and we all have the ability to give of ourselves freely. And while we can have legislation and we can have major institutions put up infrastructure, I think we have the ability every single day to do something different. So one of us, if not all of us, are going to run into a pregnant woman we do not know sometime in the next 24 to 48 hours. And I hope that each of us after today will stop and tell that person just how much we appreciate them and what they have done and what they go through. So thank you very much, everyone. And thanks for listening in. And I want to thank the mayor again for not just her support in general for what she's done for the city, but also what she continues to do in general on these issues and on the overall healthcare in the city. Thank you.
Just the name itself, I really like it. Jubilee Jumpstart, like you're jumpstarting your kids to a great future. I really enjoyed the name.
Come on, everybody.
It's like a community. It's like a family here. When I brought my kids here, I said this will be a place where I will probably keep my kids here for a long time. I'm a student. I'm a single parent. I'm striving to get my degree, and that is a goal that I'm setting in place for myself, and I'm going to get there. I have 2 kids here. My oldest, Cedric, he's been here since he was 5 months. He's now 4. My youngest, Sydney, she has been here since she was 5 months as well, and she is now 22 months. I mean, I struggle like a lot of other parents, but a lot of my difficulties and struggles that I've had since my kids been here, staff have seen it and they've asked, do you need the help? What can we do to help you? And that right there is something that's big for me.
Enrollment means everybody is starting their Jubilee Jumpstart journey. Children go into their classrooms and we almost immediately are talking to parents about their opportunities for engagement, connection, and growth themselves.
There's different parenting groups you can do. To have a group that you can connect with and be open with and share, it was great. We shared different parenting styles, parenting techniques, and that's what helped me.
Jubilee Jumpstart was founded to address the opportunity and achievement gap. We see in our city and our country that children with less opportunity achieve less, and that is generational. So when we want children to get on a path of lifelong learning, they are supported in that by the people around them also participating in lifelong learning.
When he started here in Jubilee Jump, his mind changing like 100%. They helped me to be a better mother, good person, extra good person. Jubilee helped me to feel more comfort about my person, understanding to my son. They helped me a lot.
When you teach at this age, they grasp things like they're sponges. It's just amazing seeing him like grow. Like he loves to teach other people things. He'll show other people things. And it's amazing. And the teachers, I credit the teachers a lot. They are amazing teachers.
Jubilee Jumpstart is a special place for me because they gave me so much. Courage, wisdom. It was life-changing.
We learn in community and in relationship. And so our little place is a place where community is built, really family is built, that changes the trajectory. Children can do anything if they are given the right launching pad for it.
We don't just own anybody, we welcome whoever comes in, and we give everybody the opportunity to be here.
Nobody seems to get kicked to the side or the curb. If you see someone that's struggling, hey, you need some help? Let me help you. That's the type of community this is. That's the type of center this is. They're there for me.
To those people who help this center, the only I can say is thank you. God bless those guys who donate those money. Thank you. Thank you, thank you, thank you.
There's a major crisis with America's health system. Millions of people, including many with health insurance, are unable to get the care they need. The solution is simple. Having access to reliable, high-quality healthcare is the way to keep people and communities healthy.
That is why 30 years ago, we created Mary Center, because we believe that everyone should have access to the best possible health care, regardless of their ability to pay. For us, quality care is not a service. It's a human right.
For Mary Center, quality care goes beyond just medical care. It includes access to the very best in dental, behavioral health services, low-cost pharmaceuticals, education, and social services. We believe healthy people make healthier communities. So we've decided to refresh our look to show that by connecting each person to the best possible care, we will not only improve lives, but we will strengthen communities too, one person at a time. When Mary Center puts care at the core, you can too. To schedule an appointment or find out how you can help, visit our centers or go online at marycenter.org.
This is a vaccination to keep you healthy. You don't want the measles, do you? Here's your sticker.
Protect your loved ones and they'll pass it on. Don't let COVID-19 stop you from protecting your child.
You're next, Mr. Bear. You need a flu shot.
Now more than ever, it's important your child receives their vaccines on time. Brought to you by the District of Columbia Department of Health.
All good. See, it wasn't that bad.
Do you worry your preschooler doesn't walk, talk, draw, or play like other children their age? The Early Stages Center can help. Our friendly staff will assess your child's development through one-on-one, play-based activities. Early Stages will then connect your family with the educational services that are right for you. Everything is free, whether your child is in public school, private school, or are not yet enrolled in school. Call 202-698-8037, a service of the DC Public Schools.
This is a total no judgment zone. We don't want parents to feel like because of X decision that they've made that they've done something the wrong way, because I know how sometimes difficult it is to manage diet and brushing. So it's important to put families at ease, encourage instead of discouraging, and making sure that they know that we are partners in their care, and not those that are there just to wag a finger or judge them about anything that they're doing. To get a call from a parent that says, I can now breastfeed my child because of you. Maybe they've been told elsewhere they'll never breastfeed their kid, and a simple procedure to do something now changes that whole trajectory for them. Or a child that may have been referred to me and no one can do anything with them, and they come in and I'm going, really? The kid walked in and out smiling, like we had a ball. And we didn't have to do anything like sedation or general anesthesia, which we do pretty often, for them. We didn't even have to do that. A simple, just encouraging, it's gonna be okay, we've got this, we're gonna do it together, let me know what you need. Just kind of thinking about families and thinking about my own family as we make decisions within our practice.
Listen, every day in America, workers are forced to make the unthinkable choice between caring for themselves and loved ones or keeping their job. You know how that can be. Beginning July 1st, 2020, workers in the District of Columbia will be eligible for paid family leave. That's right. When your loved ones need you most, you should be able to step up to the plate and take care of them. That's why DC Paid Family Leave will provide up to 8 weeks of parental leave to bond with a new child, 6 weeks of family leave to care for a sick family member, and 2 weeks of medical leave to care for yourself when facing a serious health condition. Hey, we understand that sometimes life happens, and you shouldn't have to choose between your livelihood and your loved ones. So if you want to learn more about DC Paid Family Leave, check it out at dcpaidfamilyleave.dc.gov.
Complete the 2020 U.S. Census. It is safe and secure. It benefits your city, your community, and your family. When you fill it out, you will help determine where billions of dollars will go, funding our kids' education, school breakfast and lunches, healthcare and Medicaid for our seniors, better social services, creating more affordable housing, job training, and helping everyone have access to food. Complete the census online, over the phone, or once you receive it in the mail. You matter. Get counted. 2020census.gov.
is we've been able to really shift our care according to what we feel like the population needs. I think one of the things that makes us strong is that we provide culturally aware care. I think it helps that the majority of our midwives are of color. When we're talking about birth disparities, especially with African American women, I think that we are now entertaining the conversation about years of generational distrust with a lot of healthcare systems. And so I think that we create a safe space for that interaction, not only by having more staff of color, but also just things like our late policy. Midwives, we see our patients regardless if they're late. We see pregnant patients late and we see babies late.
Our whole family is just tied up into Community of Hope.
Hi, I'm Heidi Murkoff, author of What to Expect When You're Expecting, and you may have heard moms matter to me a lot. That's why I founded the What to Expect project and why I'm here to support Mayor Bowser's National Maternal and Infant Health Summit, because every mom should matter. I always say motherhood is the ultimate sisterhood, that no matter where she lives, her cultural, socioeconomic, political profile, the color of her skin, every mom shares a common goal. Every mom wants the best for herself and her baby. But far too many moms, especially Black moms, don't receive the quality, respectful prenatal care they need and deserve. Too many Black moms die of complications of pregnancy and childbirth, and far too many of those deaths are preventable. And the onset of COVID-19 has increased the risk for Black moms. Gaps are widening as clinics and hospitals in rural and urban areas close, and care becomes even less accessible, and more of our most vulnerable moms I speak to every day, are falling through the cracks of care. The truth is we can take care of our moms and control pandemic at the same time. We just have to pick our healthcare priorities, and we have to stop always putting Black moms last, like they don't even matter. One way we can do that by voting. This year, WhatToExpect.com, a home to over 19.6 million moms, and the What to Expect Project have launched #MomTheVote to urge moms to speak up and be heard, to vote for those who vote for them, for maternal health care that doesn't discriminate or come with a use-by date, and that isn't paused because of a pandemic, for paid family leave that allows moms to care for themselves and their babies instead of forcing them back to work after only a week or two, affordable childcare, and so many other policies that impact their lives and their children's futures and that of their mom sisters. There's no better investment in our future than the health and well-being of our moms, all of our moms, no exceptions, no disparities. Let's stop failing our moms. Let's make moms the priority they should be.
I'm Polly Donaldson, Director of DC's Department of Housing and Community Development.
and I wanted to talk about affordable housing in the District of Columbia and our affordability crisis. The rule of thumb is you should only spend about a third of your income on your housing needs. We know we have to do more in the District of Columbia.
Mayor Bowser has been a national leader in affordable housing policies and funding, but she realizes we need to do more. So she challenged the city to produce 36,000 housing units by 2025, with 12,000 affordable to low-income residents. Our first analysis is looking at where affordable housing is across the city and where it should be in the future. This summer, we asked residents to examine a map of affordable housing in the city.
I feel the distribution of affordable housing in the city could be a lot better. It seems too much of it is concentrated east of the river in Ward 7 and 8, and not enough of it in Ward 3. Ward 3 would be a perfect place to have more affordable housing. It's resource rich.
For me, housing and affordable housing is personal. I first got involved in producing affordable housing for our homeless families over 30 years ago. To me, it's all about who is your neighbor, and are we able to say that anybody who wants to be in the district, whether you've been here for 5 generations or for 5 minutes, there is a place for you in the District of Columbia.
Clara is our first child, and we didn't know what to expect being first-time parents. And it's just been such a fun experience to watch her grow. Starting out very early, we monitored Clara's development using the Learn the Signs Act Early checklist. It was just an amazing resource to be able to say, okay, this is what she should be doing at this age. And it calmed our fears a little bit.
I would have to say my favorite resource of the Learn the Signs Act Early would be the app. But having the app readily available has honestly been great. And it's been awesome just seeing her development and growth. The Learn the Signs Act Early app is actually very easy to use. I can access it right there on my phone. And whenever my mind kind of pops to it, I can open it up.
I think I am a Learn the Signs Act Early super user. The Learn the Signs Act Early materials have been invaluable to me because I feel like they've been there with me throughout parenthood in kind of the way that a wise old friend might be.
Using Learn the Signs Act Early has helped me monitor my daughter's development and gives me a great peace of mind that the information is accurate and it's backed by science. It's fun to see when she achieves a milestone. I feel very proud for her and excited.
And it's not just a milestone of, is my child doing this next thing? It's what should I be working with my child next? Because that can be a big question mark as a first-time parent.
I want to know if maybe she's lagging farther behind than she really should, and that's something to bring up with our pediatrician.
Having something at my fingertips to kind of go through it with her physician. She's hitting these milestones, but not these other milestones. Should I be concerned? What kinds of things can I do to bring her up to speed? And then taking that and translating it with her teachers in her classroom to make sure these are the things I would like to focus on, and how can we work together to make sure that she's developing appropriately.
The Learn the Signs Act Early resources empower parents to take a stake in tracking their child's developmental milestones.
Please welcome back Dr. Faith Gibson Hubbard, Executive Director of Thrive by 5.
What a great day this has been thus far, and I am so excited to introduce our final panel for today. As you know, we have a full week of breakout sessions still ahead, but this panel, panel 3, in the forefront, moving the needle forward on perinatal health through youth, voice, and advocacy is one that's really exciting for me. As we know, this is one panel that will really help us look forward through the eyes of young parents and youth in a really inspiring way. So our panelists include moderator Nicole Lynn Lewis, who is the founder and CEO of Generation Hope, Madeline Stewart, who is a maternal health advocate and high school student. Natasha Washington, who is the program manager of Elias Cradle, which is affiliated with Sasha Bruce Youth Works. Kenise Johnson, who's a resident at the Transitional Housing Program, and Mr. Joseph Youssef, who is a music producer and college graduate and parent himself. So I am excited to introduce this panel, and I now turn it over to the moderator.
Thank you so much, Dr. Gibson Hubbard, here and to be moderating this wonderful panel. I want to thank everyone for tuning in and being a part of today's discussion. And I want to encourage you to join the conversation on Twitter using the hashtag DC Maternal Health. We'd love to have you following along and sharing your thoughts on Twitter as well. I want to jump right into our questions for our wonderful panel today. Why do you think, all of you who have joined us today on the panel, why do you think it's important for young people to be active and vocal in advocating for maternal health? If you all could share just a few insights on why do you think this is important?
I can go first.
Yeah, thank you.
So I think it's important because maternal health is an issue that affects every single person. We all came from women. We all have women in our lives. We all came from moms. So it's not just an issue that affects a certain demographic. It'll affect all of us. Men who are planning to have babies with women, men who are planning to adopt, and vice versa. So it's not just one thing or one issue for one person. It affects us all, which is why it's so important for us all to advocate for it.
Thank you so much, Maddie. And Joseph, I don't know if you want to provide your comments there as a father coming to this issue.
At this very moment with that topic, I do not have a comment.
Okay, no problem. No problem. We'll let you gather your thoughts. Natasha?
Yeah, hi. So just to piggyback off what Maddie said, I think that is very important. And over the course of the next 3 days, we're going to have the opportunity to hear from all of these young people on the panels, and we're going to be able to hear their experience. And I think it's so important that we also take note of their observations and recommendations. We want to encourage, continue to encourage our youth to have a voice and be active in the community. It sets a tone that they are here and that they're present. And it reminds the community about their personal goals. So hopefully through advocating, they can get some of their personal goals accomplished.
I love that. I love that. Kenise, anything you wanted to add?
I believe that maternal health is important because we never know what the next young mom may be going through. And if that person is able to speak up and help that they may need and not go through certain things by themselves, I feel like it could be a helping hand through the community.
Absolutely. And the work that we do at Generation Hope, helping teen parents get their college degrees, we are so in support of making sure that young parents and their voices are included in the maternal health discussion. And it's something that I think has really been missing. I'm so appreciative that this forum is providing a space for us to include this voice and the youth voice in general in the maternal health discussion. Kenise and Joseph, I think that's a good segue for us to talk about, if you can each share a little bit about the maternal health barriers that you face as young parents. If you could talk about access to prenatal and postnatal care, health care in general, housing, nutrition information and resources, anything that really sticks out to you in terms of your ability to access maternal health supports as young parents.
You like to go first?
You want to go first?
You.
Okay. Well, for myself, I think that it's important for us to have access to transportation because with the COVID going on, it's much harder now because now they're especially prioritizing who receives transportation to and from appointments. So that means that a child may miss their shots because their mom can't afford to take them to the doctor, or they may not have bus fare or train fare or car. Also, I feel like just having somebody to educate us on keeping ourselves up while trying to maintain our children, while trying to maintain our children's health is also helpful when it comes to maternal.
Absolutely. I can definitely speak from experience as a young mom myself, just getting to doctor's appointments without reliable transportation when I was pregnant was such a huge hurdle and an issue. And I remember missing appointments. And certainly after your child is born, that continues to be a challenge. But as you pointed out, particularly in this global pandemic, transportation is even more precarious and difficult and challenging. So such great points. Joseph, anything you'd like to add?
In my case, I really didn't have too many issues. If anything, it was more so on our end of being consistent with asking for help. When Jakayla was born, we had gotten to this program. I think it's Upper Cardozo or Cardoza something center, like right outside of Columbia Heights. And I remember being a part of that program. They provided us with so much with WIC and what is it? The Pack and Play, something like that. I can't get the right name, but it just provided us with so many resources. So, like I said, if anything, it's just more so on us being honest with ourselves and saying, "Hey, we need help," because they were definitely willing to give.
That's great. I'm curious, just as a follow-up, as a father, did you feel like you were able to be fully connected to the experience, like the pregnancy, and did you feel that providers really included you in that experience?
For the most part. Before, let's say beef happened, before that happened, definitely. Like it was a mutual ground of acknowledging both the mother and father. Great. But, when drama starts to happen, I'm not going to say people pick sides, but you got to take care of the mother. And I totally understand that. That's the number one responsibility, to make sure she's okay, to make sure she's, able to, support herself, and so she can support the kid as well. But yeah, I don't know. It's no like malicious intentions or like, I guess, negativity towards the situation. It's just, things happen.
Good. And just to clarify, beef between you and your daughter's mom, yes. Not you and providers.
No.
Gotcha.
Yeah,
Okay, gotcha. No, that's super helpful, because I think also another voice that we don't always include in the maternal health discussion is the voice of fathers. So thank you for that. Natasha, what role can providers play in increasing access to maternal health and resources?
So I did want to piggy off back really quick, because I think that the family structure is so important. And just on the front line, that's something that I'm seeing. So DC is doing a lot of work addressing different barriers, such as affordable housing and mental and physical health. But I think that something that I'm seeing is a lack of support from the people who our young parents care most about, and that's their family. So just piggybacking off of what Joseph said, even when there is conflict within the relationship, I think that something that we can do as a community is just to make sure that we continue to support the family structure as a whole, and just realize that that need for a connection, and especially during this time of isolation, is so important. So we just have to make sure that we continue that role.
So true.
Yeah, but so as a provider, we have the opportunity to work with our families on the front line, and being able to see and address any concerns or challenges. We also have that opportunity to work in the community with physicians, with partners, and our role is to act as that liaison. So we want to be able to address those tough questions and tough issues and bring them to the table, so that everyone's concerns are heard and that resources are in place and put out. So, for example, Sasha Bruce, we have multiple safe homes. outreach programs and prevention and education services. And we're located in Ward 7 and 8, where there is currently the highest maternal and infant mortality rates. So it's so important that we continue to support those efforts of maternal care programs and advocate for healthcare facilities in those areas where there are high rates of mortality.
Absolutely. It's wonderful to see that presence where it's needed most. Curious, just to build off of the kind of the young parent piece that we have here. Curious if you're seeing a reluctance from young parents in accessing any of your services, or any distrust around, care providers is something that we know, particularly for young people of color and communities of color that have been kind of marginalized from the healthcare experience. Are you seeing that, and how do you all overcome that?
Yeah, I actually am, especially amid of COVID-19. It kind of resurfaces some of our ideas and beliefs that there is a system out there that is against us. And that's how our young people are feeling right now. And we have seen that. There was also a report done that spoke to that distrust of the medical providers is there. And that's one of the things that are preventing our young people from getting the care that they need. So for me, for example, we actually addressed this issue very recently. And I think that it's important to inform and educate. So we will have groups with our young people and have a dialogue about what is being discussed in the healthcare field and what are their beliefs, and how they can vocalize their beliefs and be heard and come up with a resolution so it doesn't deter them from getting well visits if they're having issues with things like vaccinations. So we just encourage that relationship between the young people and the healthcare providers because they have a right to be heard and their concerns are valid.
I love that. I love that open dialogue and support for that. Maddie, I want to shift and talk about what role you feel that young people who aren't pregnant or parenting currently play in advancing maternal health and maternal health access. And as a follow-up or a second part of that, why should young people get involved in this issue?
Well, I think the role that people my age, younger or a little bit older play is that we are the next generation of leaders. So we're going into college. I'm applying to colleges right now. We're graduating from college. So we're kind of going into the real world, and what we say and what we care about matters, and it will influence future policies and how our country works in the future. So I think it's really important for young people to be passionate about maternal health. Like I said earlier, it affects every single one of us because we all come from women, especially Black and brown kids, because our mothers have it so much harder and worse than a lot of our white counterparts. Also, I think we can start with education and awareness. So I'm really vocal about maternal health just because it's not something that a lot of my friends or anybody I really know my age knows about. When we think of women dying in childbirth, we think of things that happened hundreds of years ago and there was no modern medicine, no technology, but the reality is it's still a very real problem, especially in the US, where it's one of the highest rates in the entire world. And then I think just kind of learning how to advocate for your own health in and outside the doctor's office, because I know a lot of women, especially Black women, don't get treated fairly by doctors. So learning how to speak up and kind of say like, no, I'm hurting, or that doesn't feel good, things like that, advocating for what you deserve is really important. And your second question was how youth can get involved.
Why should they get involved? But I think that
I kind of answered that.
Yeah, you did a great job. And I think it's so important, like you said, that that young people come to this issue and know more about it, and that we raise awareness across the board. I think a lot of times when we think about maternal health, we are often kind of thinking about it in a very narrow view, but so much happens in the womb, and there's so much that determines for that little one, how that mom is taken care of during that critical phase of pregnancy, and shortly after has so many implications for that child years later. So it's an issue that we all should care about and be knowledgeable about. So I love that you're such an advocate. Let's talk about barriers and challenges, and what are some of the issues that make thriving hard for young parents and families? And Kanice and Joseph, I know that you guys are young parents and we're young parents, so if you want to speak to that, I'll toss it over to you.
Okay. Can you repeat that question one more time?
Absolutely.
So I can make you understand it.
Yeah, no problem. If you could talk a little bit about the barriers and challenges that make thriving hard for young families and young parents, some of the things that make it difficult to be a young parent trying to provide and take care of your children.
Okay. For myself, I'm a parent of 3 young boys, and I could say not having a stable home before I was introduced to the social boost transitional program was one of the biggest barriers I had. It's kind of hard to focus when you're trying to get on the right path with your life while not being in a consistent space. So going through the shelter and being placed into the program and having my program manager, Miss Natalia Harris, give me an opportunity to really build my independence and show myself that I could be more than just a street statistic. I could be more for my boys. It really gave me an opportunity to start wanting to thrive. And I ended up enrolling in the college for computer science a few months ago. So I'll be working on my bachelor's.
That's so exciting. So exciting, Kanice. I love that. And I should mention Joseph is a former scholar and alumni of Generation Hope as a young father who we supported in his pursuit of a bachelor's degree. So Kanice, we should definitely connect after this to talk about the supports that we can offer as you're working towards your bachelor's degree. Joseph, anything you'd like to add? I think Kanice raises a really great point about basic needs, and things like food and housing are so critical for young families in order for them to thrive, and so connected to maternal health. Anything else that you would like to add?
It's quite a few. I would say definitely one of my biggest barriers that I'm still dealing with to this day is mental health, dealing with depression and anxiety and just everything within an umbrella of mental health, dealing with that. Also, to briefly mention, on the verge of being homeless, almost being homeless.
Mm-hmm.
I remember, I think it was a senior year for Howard. And, situation at home was just very rocky. And it wasn't until the very last 2 days, I think, before school started, you guys came in, was able to talk to the landlord, get me a place. And, I've been fortunate for that. But if I can just highlight one, it would definitely be mental health, just dealing with that on a daily basis. Some days you wake up being able to say, I love myself. And then there's other days you're waking up and just like, why am I dealing with this? And it's like to deal with that, plus being a parent, and it's just to even have like not even 2-parent household, but to have 2 different places where my child is being brought up. It's just so much that goes into it. But at the end of the day, taking advantage of the resources that's given at Howard and to GH as well, being able to talk to a therapist or a guidance counselor to just say like, this is what I'm feeling. I'm not okay. Like today I feel like crying. Not today, but for an example, like today I feel like crying. So, just being able to, admit when you're okay and not okay and when you need help. I think that's going to be one of the biggest things that I may just be reoccurring, just being able to express like the vulnerability of needing help.
Mm-hmm. Yep, I'm so glad that you raised the mental health piece, because it's so connected to maternal health and how families are doing, how they're thriving. And I think it's another topic that we don't talk about enough. So I love that you're honest and open about your own experiences, Joseph. It benefits many of us, and something we need to be talking about more when it comes to young families. Natasha, anything you'd like to add in your work with young families in terms of hurdles and challenges?
I think that they hit it on the head. And what I heard mostly was that support, as I mentioned, if not from families, then the communities. I think as partners, that's our responsibility, is to provide that support so they can get out of that survival mode and feel comfortable to think about long-term goals such as health and mental health, maternal health, and physical health. So I think that is definitely a good point that they made, some of the barriers they're facing.
Great. Yeah, absolutely. And it's certainly in line with what we see at Generation Hope as well. Natasha, back to you for a moment. If you could talk a little bit about, we know from what Kenise shared and Joseph, and just what we know about young families. Can you talk a little bit about your work and the housing that you all provide, and what you're seeing in terms of the impact it makes for young families, and the challenges that you might be running into in providing that housing?
Sure. So I'm actually the program manager of a transitional housing program. So we serve young single mothers ages 18 to 24 with one child. So they're new mothers and their children are between the ages of 0 and 2 years old. We provide housing. So that's the main service that we focus on, as well as case management. So being able to provide housing, first of all, takes care of a lot of their physiological and basic needs, right? Such as just warmth and clothing, food and shelter. So that's what we focus on there. And then with the case management, we work on different life skills. So maternal health is definitely one that we focus on. We have many groups to discuss some of the barriers and challenges, and also just kind of connecting them with resources that can assist them in aid. And I have found so far that the young people that I work with, because we're not the only transitional housing program, so Sasha Bruce has many housing programs that work with families and single young adults. And a lot of things that I find when I work with the youth is that they do appreciate the support that they're getting, and they appreciate the shelter, so they can have time to make decisions about their life and their long-term goals. And we've seen a lot of success from our young people who are leaving. I know Elias Cradle has 100% exit rate into permanent housing situations, and as well as other transitional housing programs with Sasha Bruce. So we're able to tackle those needs and those barriers so they can transition and live independently.
That's awesome. And I think, Kenise's story about now having the mental space and the literal physical space to be able to focus on earning a bachelor's degree, I think is such a testament to how impactful housing is, and how connected it is to the well-being of mothers and families, particularly young families. So love that work, and really cannot overstate the importance of housing in all of this. Maternal health access and outcomes is a racial justice issue. And I know that's something that we're talking about more and more, particularly in the district, but as a national conversation around maternal health. For example, we know that Black American Indian and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. Why is it important to name that? And what can we do to ensure more mothers of color survive and that all families are healthy and thriving in DC? And I will toss that over to you, Maddie, because I think you touched on this a little bit, and just the importance of this work for Black and Brown children and families.
Yeah, so I think it's important to know the history of the American healthcare system, and know especially the racist history of it. And just kind of knowing that going through life as a person of color in America is very stressful. It's very traumatic. And that will alter the way your body responds. That'll alter the way that your brain works. It'll alter the way you respond to certain medications and certain kind of health practices. So knowing all of that, it makes sense as to why women of color have worse outcomes than white women. And I think that means that we really need to focus on dismantling the racist healthcare system and putting more funding into programs that will help brown and Black women of color, especially getting proper food, getting prenatal and postnatal care, expanding Medicaid to cover them for over a year, not just 60 days, to prevent that maternal mortality. I think we can start with just education and awareness, because I know there are a lot of resources in DC, but I know a lot of young moms or just moms in general may not know that they have access to those resources. And then just education on just maternal health in general, I think could be very beneficial. And I think that kind of starts in middle and high school. And this is a little bit off topic, but I think the sexual education program in the US definitely needs to be updated and better, because I know for me, I'm a senior in high school and I've never had a sex ed class.
Wow.
And I go to, my school likes to call itself very predominant, very prestigious, very, rigorous. And I've never had a sex ed class. And I think that's very unfair, because I've had to learn everything myself or from my parents. And so I think kind of starting with education at a young age will be very beneficial to maternal health outcomes in the future.
Wow, thank you so much for that. So many great things in that response. Anyone else who'd like to add to this, the component of race in maternal health?
Yeah, I'll just throw some facts out there just so we can see why it's so important to have this discussion. So according to the perinatal health and infant mortality report, Black and Hispanic mothers face higher rates of pre-pregnancy risk factors. So those risk factors include smoking, obesity, diabetes. And then Black mothers experience higher rates of preterm births and low birth rates compared to white Hispanic mothers. And this study was taken, is based off of the residents who are residing in Ward 7 and 8, the young parents there. So we must take notice of what's happening in our community. And that is why, one of the reasons why, Sasha Bruce is present in Wards 7 and 8, where these statistics are there. And I think that it's just important that we just continue to advocate for more community health workers in those areas and access to prenatal care, because it is real. And unfortunately, Black, brown, African Americans, we are affected highly in these areas. So it's important to have this discussion.
Yeah, absolutely. So connected to the national conversation that's happening right now around racial oppression and our country's history and legacy of racial oppression, and the maternal health piece is a huge piece of that conversation that we need to continue to elevate. I want to circle back to something that Maddie touched on, which is the role of education and schools in the maternal health discussion. And I'm curious, what can institutions do, K through 12 or higher ed, colleges and universities, to be more supportive of maternal health access, and also or in helping young parents and their children succeed in their educational goals? So that's a big umbrella of a question, but I think there's definitely a role for both K through 12 and also for colleges and universities in this work. So I'll open that up and see if anyone has any thoughts there.
I'll on the table. I feel like for everybody that's in school, if they were to open up some more like Unity Health Centers inside of the school, like Baloo has, and for the young teen moms, daycare centers, because I know Baloo has a daycare center also. If they were to open up more programs like that throughout the schools, or at least have them close enough to the school that the parent doesn't have to travel far apart. So if the parent has to drop their child off in Northwest, for example, but their school is in Southeast, either the child, and they get fed up enough with it. Either the child isn't going to make it to school or the mom isn't going to make it to school. So if it's close enough and accessible enough, then I think it will motivate young parents to want to stay in school and keep their children close to them. Because I would love to go down the hallway and be able to check to see if my child is okay. Or just knowing that my child is in the same building, I would feel better about sitting here doing work all day or working.
Yep, great points. And I think childcare is such a huge issue and a huge hurdle for for parents, period, but certainly for young parents, just the affordability and the access of it. So when we think about providing more childcare supports in schools, I think that's a great point, Kanice. Others want to chime in on what K through 12 or colleges and universities? Joseph, I see you with your hand up.
Colleges. So we briefly talked about this before the stream, but you know, I would definitely recommend that all colleges put this on an application. The question, you know, are you a parent, or, you know, are you expecting? Once that data is collected, you send it to the right resource, whether that's the, you know, like guidance counseling or financial aid. Like, there's so much that can go into this, because even financial aid, all these schools, all the money you guys get, come on, you can put something aside for us, give us a little grant, whether that's $1,000 a semester, like that can go pretty far, especially as a young parent and you're in school, that go completely far. But, you know, to be able to have that, having more images of us representing us. I remember, you know, Howard is this most prestigious school, shouts out to him, I love him, but I have yet to see a poster where you see a child, a mother and a child, or a father and a child. You only get to see that individual success, and I mean, that's great. But I also need to see myself. You know what I'm saying? Like, I see the representation, but I still don't see myself. I don't see my child in that vision. And so, you know, this is one thing I was trying to work on before I graduated, but I still do have time since I still work for Howard.
And you're an active alumni.
Indeed. But yeah, we definitely have to see the representation, the finances, and just to ask that question, because I guarantee you a lot of these student parents will feel much more comfortable being able to say, hey, professor, I have a kid. That, like, even thinking about that, being able to take that information, look at the classes they're going to take, send that information already to the professor. So when that person approaches the professor and say, hey, you know, if something pops up, oh my God, you already know my situation. Well, that is so nice. You know what I'm saying? Like, those things, like, yeah.
Yeah, absolutely. And Generation Hope has been doing this work and helping teen parents earn their college degrees in our region for the past 10 years. And to your point, Joseph, there's a ton of work that needs to be done in higher ed to better support student parents. There's almost 4 million, or more than 4 million student parents across the country. About 1 in 5 undergraduate students is parenting, but most colleges and universities do not track parenting status. So that's a great place to start. It's hard to support students when you don't know what their situation is. So that's a great point.
And I also have to shout out to the professors who understand, who you'd be like, you know what, bring your child to class. Like, it's okay, I got him, he or she. Shouts out to you, professors, because we adore you, we appreciate you. To the ones that don't understand, teach his own, okay? Teach his own.
Hopefully they're listening, and then now they're going to start to think differently about it. That would be great. Anything else, Natasha or Maddie, on what schools can do?
I just think having a stable, just wellness, health, sex ed program in all schools, public, private, charter, I think that would be really beneficial. Even past pregnancy and sex and maternal health, just teaching kids about their own health and about just kind of basic hygiene, even when they're in like 2nd or 3rd grade. Things like that can go a really long way. And I know I would have really appreciated that when I was in middle school. And like everyone was starting to get their periods, and I was like, oh, what is this? Like, nobody kind of knew what was going on. And so I would really appreciate if I had a person or at school that I could go to and talk to about that. Even though it's not necessarily maternal health related, that did a lot. That would have done a lot more for my mental health, like we were talking about earlier. I just think we need a more stable sexual education program in the country.
Yeah, and I would say I think it's totally related to maternal health because it has to do with how we feel about our bodies and how comfortable we are talking to people about changes that might be happening with our bodies. And I know when we talk about young parents in particular, we come across so many young parents who hid their pregnancies for a long time because they didn't feel comfortable talking about their bodies and they worried about the stigma associated with being a teen parent. So I think 100% it's connected to maternal health is making sure that we're educated about our bodies. We feel comfortable having those conversations. We have go-to people in our community, in our schools that we can talk to about all of those things. So really great point. Natasha, anything you wanted to add?
Sure. Just from an advocacy point of view and being a provider, I think it's so important that we inform the youth of our services. Like Joseph said, if we know young people are parenting or expecting, we should inform them. So New Heights is a program that is assisting expecting and parenting young people who are in high school. They actually work with the DCPS. So you should be able to find this program in those schools in DC. They assist with those common barriers such as childcare, and their mission is to improve attendance, improve graduation rates, and prevent subsequent pregnancies and prepare students for the workforce. So there are people in the schools that can assist. And I think that it's so important that we're vocal about these services so the young people can know that, hey, I can go somewhere and get some assistance. Also, in regards to the education front, so there are school-based health centers. There are 7 total in the schools in Washington, D.C., and they provide primary and preventive care services right in the school. So they should be working with the parents. If they have children, they can receive those services during reasonable hours, such as their lunch period or before and after school. So I just think that it's so important that we continue that discussion. And lastly, with Sasha Bruce, we actually have a teen outreach prevention program that are also in the schools. So they talk about what Maddie was saying, having those dialogues even prior to pregnancy, just having healthy relationships, healthy hygiene, safe sex. So they have those discussions, and we should all know about those and be vocal about it.
Awesome. And I love that you highlighted New Heights. We actually partner with New Heights in being the next step after high school for the young parents that they serve. So shout out to New Heights. Mm-hmm. We love our partnership with you and the work that you do. It is now time to open this up for Q&A. And while we've been talking, we've had some really great questions come in from those who are listening. And so the first one is what's the easiest way to advertise critical resources, knowledge, and awareness to DC youth? And I wonder if, Natasha, you could take that one to kind of start us off, since I know that's a big part of what you do each day. If you can share a little bit about best practices there.
Yeah, it's getting out there and having those tough conversations. I think that it's important that we build our relationship with the community and just change that narrative of how we see young parents. And instead, when we meet the young parent, we think about what do we want them to learn from this experience with us. So it's about having those conversations about mental health and maternal health. Be creative and get out there on social media and advertise and find out where your core population is gathered and just going out there. A lot of our services are outreach services and community-based services. So just having presence in the community is vital so that the young people can make that connection and get those services.
Got it. And Maddie, do you want to add anything there in what you're seeing as effective ways to get the word out to youth?
Yeah, so it's always a little bit hard, especially with high schoolers, because we only care about things that directly affect us, which is kind of frustrating when we're trying to do bigger social justice work or anything like that. But I think, like Natasha said, social media definitely, because I don't think we realize how much we absorb from social media until we're asked about something like an hour later. We're like, oh, I saw that for like 30 seconds on Instagram, you know? I think like YouTube ads, things like that. Just thinking about how you normally get all your information, like on the news, the radio, just putting out information like that and make sure it's getting to all wards in DC. Because I know Ward 7 and 8 tend to be left out of the mix a little bit, which is very frustrating. Because that's where there's a high concentration of Black and Brown people there. And that's why there are so many maternal mortality outcomes in that region. But I think definitely social media and advertisements would be the best bet.
I love that you were honest about we don't care about something unless it directly impacts us. That's awesome. And actually really great insight. Kanice and Joseph, do you have any ideas? One thing I want to really just point out is that I think young parents are even more difficult sometimes to reach for tons of different reasons. One is just like not having the time necessarily to devote to even perusing social media as much as other young people who don't have children, or if you're dealing with housing insecurity, it's all consuming, and so you may not have time. You may not be showing up for school, or lots of different things. So, any advice for how to reach young parents with these critical resources?
I don't have anything to add to that. I'm not sure.
Okay, that's totally fine. One thing I can say, I would echo all of the things that Natasha and Maddie spoke about in terms of ways to reach out to young people with this information. The other that I would add is really just getting the word out in terms of partnering with other organizations. Generation Hope has worked really hard over our past 10 years to really connect with other organizations that are doing great work, that are supporting the population that we're trying to reach. We go out and we provide free workshops and trainings on site wherever we can find young parents. It could be at a homeless shelter, it could be at a church or a social service agency, as a way to help them in their efforts and in their mission, but also as a way to get in front of the young people that they serve. And so I can't say enough about just the importance of leveraging those establishing partnerships, and leveraging those partnerships so that other organizations can complement your efforts in getting the word out and trying to reach young people with that information. And I think also the medical community, we can definitely do more to partner with providers in getting the word out about the programs that we offer. So those are two things I would add. Another question came in, and this is speaking of beef that Joseph mentioned, not the beef you eat, but the turmoil or tension beef. One of our viewers has a question about whether access to relationship counseling or family coaching would be helpful.
See, this goes into a whole nother topic, because it's like with Black families, therapy, sitting down, talking about our feelings, like that's kind of like, what is that? You know what I mean? I'm down for it. By all means, I am down for it. But I've tried in the past. I've tried, and it's like, no, that's crazy. That's insane. Why do we need these people? Who I want to outside to come into our business? And it's like you're thinking about it from the wrong perspective. It's not someone's coming to judge you. It's someone that's coming to mediate the situation. Like all I can say, I've tried it, and once again, we're not there yet. Like I'm optimistic for the future. Hopefully, we come together, and we're able to sit down in therapy and discuss these things. But as of right now, that's not even on the table.
I hear that. I totally hear that. I think similar to mental health supports, there's a stigma around counseling in general, whether it's for mental health or if it's for mediation, that is hard to overcome sometimes. And one thing I will say at Generation Hope, I think we've had some success with both mental health and just conflict resolution, in that we really build trust with our students. So our students are with us for up to 6 years as we help them get their college degrees. So I think building trust goes a long way in your ability to have a young person participate in any kind of counseling and therapy. And we've just found that to be really effective. Anybody else want to weigh in on the therapy or the mediation? Okay, so we have another question. What is the most critical support you need right now? And what critical support would have been important for you that should be available for other youth in the future? So I know we talked about housing as being really, really important. Is there any other critical support, particularly right now, even in COVID-19, that has been really beneficial to you?
I need green. I need dollar bills. That's what I need. Like,
Got it.
COVID kind of messed up my whole, boosting up my salary and all that. So it's definitely been a struggle. But if anything, critical money, a sense of just peace as well. Being able to go to a destination and be like, you know what? I can cut my phone off. I can leave social media behind. Let me enjoy life. Let me enjoy nature.
I love that. Both of those. I hear that loud and clear. Kenise, I saw you nodding your head.
I was agreeing with Joseph about our economic situations right now, because since COVID-19 started, trying to pay for school, my car note, car insurance, and save money to try, for my time coming up, and then from the Sasha Bruce transitional housing program, it could be very overwhelming. And right now, it's kind of like DC has not decided on how they're going to really help us during this time. So the wait is frustrating, but I feel like the more we reach out and the more that we show that we deserve to actually be helped during this time, I think that it'll work out in the end.
Yep, absolutely. And I think we're seeing the same thing with our students. Just the ability to pay bills and make ends meet is the most immediate and critical need right now. So 100% hear that. Natasha and Maddie, this next question would be great for you guys to weigh in on. What organizations should we consider getting involved in the focus on maternal health and birth equity?
I think that we're doing a great job collaborating with each other. There are so many nonprofit agencies, youth-led agencies or initiatives that are taking place. And so I think that we should continue the good work and having discussions like this in places like this where we can come together and network and collaborate and look at our challenges and see how we can go forth and fix them. So, just to name a few, Sasha Bruce has a lot of different programs, and we're really in the community and engaging about health and maternal health and mental health, as well as New Generations, Nicole, and all the others. So I think that it's really at our fingertips, the information, and that we should just go out there, be comfortable, and see what's in our area, what services are being provided, and go to those community centers and to those churches and ask how they can help, because I think we're doing a great job.
Yeah,
awesome.
I think we also have to remember to keep all of these social issues intersectional. So including resources for disabled girls of color, for LGBTQ plus girls of color. I think keeping all of that in mind, because I know sometimes we just think either low income or non-graduated from high school, things like that. But remember to intersect all of the identities, because there are a lot of marginalized groups out there within the people of color. So I think just remembering to keep those in mind and then partnering with those organizations that do specifically target those groups would definitely be really beneficial.
Yeah, no, I totally hear that. And I think when we think about it, the intersectionality, it almost broadens the group in terms of how many different organizations should and could be coming together around maternal health. So that's a really great point. Another question For Kanice and Joseph, as young parents, would it have been helpful to be able to access all services that you needed in one place? So for example, mental health, prenatal care, applying for social services, as opposed to going to different places.
Thinking back on it now, no. And I say this because I wouldn't have like met all these wonderful people and been introduced to all these various programs. Yeah, no. I mean, obviously I understand like the bigger picture, like someone would love to have that in one place, but in my case, being able to go from Columbia Heights, LAYC over to Michigan Avenue to Generation Hope, all the way to Virginia to, Cactus. Yeah, I don't know. I love traveling. I love going places. So it doesn't really make a difference for me.
Got it. Kanice, anything you'd like to add?
I agree with Joseph. I feel like the more even though transportation is a problem for some, those people, they would like to go get everything knocked out in one place. Me, transportation isn't an issue for me. So meeting the different people that I've met through my journey has been great.
Got it. That's really insightful. I have one more question for you guys, and then we'll close out. And really quick, if you could tell us what is giving you hope right now. And we can start with Natasha.
Oh, wow. That's a big question. There's a lot in the world. So what's giving me hope is just my family and the work that I do. I absolutely love working with the young people and young families and just being that support system and being able to see how they benefit short-term and long-term. That's what gives me hope, to hear those stories about how they've overcome or they've accomplished something, or just that feeling of being, accepted or a part of the group. That's what gives me hope during this time.
Awesome. That's awesome. Maddie?
I think just seeing a lot of kids in my generation really starting to speak up against social issues that I know I have been well aware of for my entire life, but definitely seeing people from non-historically marginalized groups starting to speak up against Black Lives Matter and everything like that, that's really giving me a lot of hope. And then also I'm applying to colleges right now, and that's a fun but stressful process. So trying to think about what I can accomplish in the future and how I can help people is giving me a lot of hope as well.
That's awesome. Joseph. Uh-oh, I can't hear you, Joseph. I don't know why.
You hear me?
Yes.
There we go. Phew. All right. There's so many responses. What's giving me hope? I guess I'll be simple. I can't be simple. I'm trying to think. All right. What gives me hope is people, honestly. We live in a tough environment. I can't even say tough world because it's like the people make it what it is. But right now, with Black Lives Matter, with just social justice being like the forefront of just everything from video games to entertainment, it's just, I don't know, like even chaos gives me hope, sadly. Like I encourage everyone to go out there and vote, because this is the year where it really matters, because you can't deal with another 4 years of that orange. We just can't. So I would say, to wrap it all up, what gives me hope is the hope and the actions of people who believe that, we deserve more. We're equal. We're not lesser than, greater than, we're equal. So it's the best way for me to put that.
Thank you. Kanice, you'll be our final response.
Outside of my children being my daily motivation, I could say that waking up every day gives me hope, because the way that the violence has been going on in the city lately, you could walk outside and a bullet just hit you nowadays. You don't even have to be doing anything wrong. You could just walk outside and anything could happen. So making it back in the house safely is what gives me hope. And knowing that I'm working towards the bigger picture for my future is also making me continue to push harder, because I can't have my young 3 boys ending up in the streets. That's not going to work out for me. So that's it.
Got it. Awesome. Thank you all so much for being on today's panel. And I hope you know that you guys are giving others hope by sharing your experiences and insights today, including me. So thank you for the good work that you're doing. Thank you for your persistence and perseverance. And thank you all for joining us and being a part of today's session. We appreciate you.
Thank you for having me.
Thank you.
Please welcome back Dr. Faith Gibson Hubbard, Executive Director of Thrive by 5.
Today's panels have really been so inspiring, and I have to say that last panel and really what is giving us hope gave me so much hope actually for the rest of the week. We have some really great discussions planned for the rest of the week, but I first want to thank you for joining us for today's summit kickoff. And I say kickoff because we have 3 more days to go, and we want to make sure that we see you there every single day. So while today has been a call to action, it is now time for our collective action and for us to really retool our perspectives and also the actions that we hope to take next. And you can do that by joining us tomorrow and the day after for some really phenomenal breakout sessions, starting, as I said, tomorrow at 10 a.m. And each day from 10 a.m. until 3 p.m., we will have consecutive sessions about a multitude of topics, from the things that we discussed today, COVID-19, health equity, and mental health and fatherhood. So I hope that you'll stay tuned. I hope that you will go back on to dcmaternalhealth.com in order to look at the schedule and also join us on the Hoover app, which I hope you all have connected with. But if not, remember, there's no barriers to accessing the information. You can join us right back here on the Mom Health DC Facebook page or on YouTube Live. So with that, I look forward to seeing you, each of you, tomorrow.